to start now, Dusty. Can she
I'd
go
like
ahead and
I'd like to see if there's just a few minutes to get Melissa to
There's feedback and echo.
Good morning. I would like to call the July 23rd, 2020 board meeting to order. The time is 9:08. I will start the meeting this morning with the board's mission, statement, and philosophy. The mission statement. The mission of the Texas Board of Nursing is to protect and promote the welfare of the people of Texas by ensuring that each person holding a license as a nurse in the state of Texas is competent to practice safely. The board fulfills its mission through the regulation of the practice of nursing and the approval of nursing education programs. This mission, derived from the Nursing Practice Act, supersedes the interest of any individual, the nursing profession, or any special interest group. Our philosophy, acting in accordance with the highest standards of ethics, accountability, efficiency, effectiveness, and openness, the Texas Board of Nursing approaches its mission with a deep sense of purpose and responsibility and affirms that the regulation of nursing is a public and private trust. The board assumes a proactive leadership role in regulating nursing practice and nursing education. The board serves as a catalyst for developing partnerships and promoting collaboration and addressing regulatory issues. The public and nursing community alike can be assured of a balanced and responsible approach to regulation. I would like to welcome all our board members, board staff, and audience this morning to the very first virtual full board meeting. This meeting is being held pursuant to the Texas Government Code Section 551.127 and in accordance with the governor's disaster declaration related to the COVID-19 pandemic and his subsequent orders. Before we begin this morning, I'd like to remind everyone to please keep their line on mute until they wish to address or speak to the board. And at the time an individual wishes to speak to the board, they should unmute themselves, and then after completing their remarks, should return their line to mute. Please remember to turn off any apps and/or email that may be open or running on your devices for the duration of this meeting. Finally, please remember to mute and/or turn off any cell phones. I would also like to remind everyone that the meeting today is being recorded and at the same time is also being sent out through a live link to the board's YouTube channel for the public to be able to observe this meeting today as it takes place. We will begin with the board member roll call. Ms. Thomas?
Good morning. Representing LVN Education, Carol Hawkins.
Present.
Representing RN Practice, Laura Disk. Ms. Disk is absent. Representing RN Practice, Diana Flores.
Present.
Representing Consumers, Maisie Jameson. I believe Ms. Jameson may be on, but her line is muted. Ms. Jameson, can you unmute yourself?
Present.
Thank you. Representing LVN Practice, Kathy Leader-Horn.
Present.
Representing Baccalaureate Nursing Education, Allison Porter Edwards.
Present.
Representing Associate Degree Nursing Programs, Tamara Rhodes.
Present.
Representing Consumers, David Saucedo.
Present.
Representing LVN Practice, Melissa Scott. Ms. Scott is trying to join. I'll note it when she just joined. Representing Advanced Practice Nursing, Kathy Shipp.
Present.
Representing Consumers, Francis Stokes. You're muted, Mr. Stokes.
Now.
Now.
Present.
Representing Consumers, Rick Williams.
Present.
Representing LVN Practice, Kim Wright.
Present.
Madam President, we have a quorum.
Thank you. In addition to board members, there's staff that are on this call as well, this virtual meeting. Kathy Thomas, Executive Director, Dusty Johnson, General Counsel, Dr. Chris Benton, Director of Nursing, Tony Diggs, Director of Enforcement, Mark Mayak, Director of Operations, Dan Fletcher, IT Supervisor, Sierra Williamson, Executive Assistants, Patricia Vianas Cabrera, Executive Assistant, Dr. Virginia Ayers, Education Consultant, and Dr. Jan Hooper, Educational Consultant, lead. At this time, I'm showing that Melissa Scott is on, a board member. Melissa, can you hear us?
Hi, yes, this is Melissa. I can hear you. Can you hear me?
Yes, so we're marking you as present.
All right,
Thank
thank you.
Okay, board members and staff, let's get started with reviewing the agenda. Are there any changes, corrections, amendments to the full agenda?
Madam President, there are no changes to the agenda.
Thank you. Tamara Rhodes, can I get a motion to approve the agenda?
I move to approve the agenda of the July 23rd, 2020 board meeting.
Is there a second to the motion to approve the agenda?
This is Maisie Jamison. I second.
Thank you. So having a motion and a second to approve the agenda, if no objection from board members, the agenda is approved. This vote is being taken according to the Board Policy 2.7, Simplified Parliamentary Policy Rule 4. All right, board members, let's review the minutes from the January 22nd, 2020 board retreat, January 23 to 24, 2020 board meeting, April 23, 2020 eligibility and disciplinary committee meeting, June 8, 2020 emergency board meeting, and July 6, 2020 emergency board meeting. In reviewing this before we came into the meeting, did you find anything that you want to change in any of those minutes? So seeing nothing from any of the board members. Kathy Lederhorn, can I get a motion to approve those minutes?
Yes, ma'am. Kathy Lederhorn, giving a motion to approve the minutes as presented on the agenda.
Thank you. And is there a second from Ms. Porter Edwards?
I'll second.
Thank you. Having a motion and a second to approve the minutes, if no objection from board members, the minutes are approved. This vote is being taken according to Board Policy 2.7, Simplified Parliamentary Policy Rule 4. Let's move on to the consent agenda. Board members, are there any items on the consent agenda only that anyone would like to have pulled off the consent agenda? This is for the consent agenda only. Seeing no response, continuing with the consent agenda, board members, are there any recusals for the consent agenda? Seeing no response, are there any other items on the consent agenda only that anyone needs to recuse themselves from? This is consent agenda only. Seeing no response. Rick Williams, can I get a motion to approve the consent agenda?
Madam Chair, I move that the consent agenda be approved.
Thank you. And Mr. Saucedo, can you second that motion for me?
I second the motion.
Thank you. Having a motion and a second, we will now take an oral vote. Allison Porter Edwards? Yes or no? Okay, 4. Diana Rodriguez Flores?
Four.
Carol Hawkins?
4.
Kathy Lederhorn?
Kathy Lederhorn, 4.
Maisie Jamison?
4.
Tamara Rhodes?
4.
David Saucedo?
4.
Melissa Scott?
Four.
Francis Stokes? I think you need to
4.
unmute. Okay, 4. Great, thank you. Rick Williams?
4.
Kim Wright?
4.
And myself, Kathy Ship, 4. So the motion passes. Board members, staff, audience, we will now begin with the consideration of the agenda items. And the first item for consideration will be agenda item 3.2.10A. Consideration of proposal to establish a new education program submitted by Collin College in McKinney, Texas, Vocational Nursing Education Program. This is public hearing for a new nursing program. Under section 301.157 of the Texas Occupations Code, the Board of Nursing is charged with the responsibility to prescribe and publish the minimum requirements and standards for a course of study in each program that prepares registered nurses or vocational nurses. The board has received a proposal from Collin College to establish a new nursing education program in McKinney, Texas.
Madam
The purpose-
President, if we could
Yes.
pause for a moment for our Collin County representatives to join. Dr. Ayers is, I think, talking with them now. So we're just joining them into the meeting.
Okay, I
I
see,
see Jay.
and I see Ann McNamara.
Okay.
The Collin College representatives appear to be here. Dr. Jane Leach and Ms. Jane Lopes are representing Collin.
Okay. Thank you.
Okay. The purpose of this hearing is to allow an opportunity for interested parties, individuals, and organizations to present testimonies to the board in order that it may determine whether the proposal from Collin College will meet the minimum requirements established by the board. Members of the public were provided prior notice, both on the file with the Secretary of State's office and on the board's website. And this notice is of the opportunity to request to present verbal or written testimony related to this hearing and the instructions for doing so. Board staff has received no such requests. The proceedings this morning will be presented in the following manner. The persons who will be presenting on behalf of the nursing education programs will be given 15 minutes to make their presentation. Please make your comments as concise as possible. At the beginning of your remarks, please tell us who you are and who you represent. And if you're addressing particular parts of the proposal, please identify them before you begin. If you wish to submit written testimony or to supplement your oral remarks with written testimony, you may do so at the close of this hearing by submitting those comments to board staff via email. Will the representatives of Collin College Nursing Education Program raise their right hand and be sworn in? Do you solemnly swear or affirm that the testimony you're about to give before the Board of Nursing is the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you. The board now recognizes Dr. Virginia Ayers. Dr. Ayers?
Thank you. Good morning, Presidentship and board members. Collin College is requesting approval to establish a vocational nursing education program in McKinney, Texas, to begin August 2021. Collin has operated a successful associate degree nursing education program since 1990. And this program is the only associate degree program in Texas to earn the National League for Nursing Center of Excellence in Nursing Education designation. Collin College was recently approved to provide an RN to BSN program. Collin has approval from the Texas Higher Education Coordinating Board to offer the VN program and plans to apply for National Nursing Accreditation from the Accreditation Commission for Education in Nursing, or ACEN. The 12-month VN program of study will be offered on 2 of the 5 new campuses of Collin College, one in Wiley, Texas, and one in Allen, Texas. The VN program will utilize a staggered admissions process, as one campus will start in the spring semester and the other will start in the fall. The proposal requests an initial enrollment of one cohort of 24 students at each campus for a total program enrollment of 48 students per year. Exemplary clinical learning experiences for vocational nursing students have been secured in the McKinney area at a variety of healthcare facilities, including Methodist City Healthcare in Irving, Methodist Dallas Medical Center in Dallas, Methodist Richardson Medical Center in Richardson for acute care and behavioral health, and Founders Plaza Nursing and Rehabilitation in Wiley. Ms. Jane Lopes, the proposed director of the vocational nursing program, is an accomplished nurse educator. Ms. Lopes has 39 years of professional nursing experience with 26 years devoted to nursing education. She has served in both faculty and program director roles during her career. I would now ask the Collin College representatives to introduce themselves and share their vision of the new program with you. Thank you.
My name is Dr. Jane Leach, and I am the Dean at Collin College, and we are just thrilled to have this opportunity. This program has been set up to help us have a seamless pathway of LVN students to also be able to go to an LVN to RN program, and then should they choose to become an RN to BSN. The curriculum was set up as a concept-based curriculum to allow this seamless process and to hopefully help inform and improve the workforce in this area of Texas.
Thank you.
Good morning. My name is Jane Lopes, and I am the proposed director of this new program. I would like to tell you a little bit about the program, although I think Dr. Ayers did a great job there. Let me tell you a little bit about Collin College. We were established in 1985. We are celebrating our 35th anniversary this academic year. We educate more than 39,000 students per year. So we are a large institution. We offer more than 100 degree and certificate programs. We are accredited by SAC, COC, and the Texas Higher Education Coordinating Board. One of the things that we offer is that we're proud of is that we have the lowest tuition of any state colleges in the state of Texas. We have currently 8 campuses in operation. We have 2 brand new campuses that are opening next month, and that's where our vocational nursing programs will be. And there are 3 campuses presently under construction. As Dr. Ayers alluded to or described to you, we have currently 3 nursing programs. So the vocational nursing program will be the 4th. So we have the traditional ADN program, we have an LVN to RN bridge program, and we have an ADN to BSN bridge program. These programs are approved by the Board of Nursing, by ACEN, and we were just awarded the beginning of this week another 4 years from as a center of excellence from the NLN. So we're pretty proud of that. Our goal is to have a very seamless pathway from LVN all the way through BSN. Our college mission statement says that we are a student and community-centered institution committed to developing skills, developing character, and challenging the intellect. Now, this is all the way through every curriculum and every program. Our core values are also threaded through all of our curriculum, which states that we have a passion for integrity, academic excellence, nursing, service and involvement, and creativity and innovation. The LVN program that we are proposing is a 12-month face-to-face VN program offered on 2 different campuses. It will be a total of 46 credits and a total of 1,280 contact hours. Lecture hours will be 464. Clinical lab and interactive activities will be 816. So the ratio of theory hours to clinical or lab time is going to be 1.8 clinical hours for each 1 hour of theory. Each campus, the Allen campus and the Wiley campus, will each admit 24 students. Allen will admit in January, and Wiley will admit in August. The reason for these staggered admissions is so if we have a student who is unsuccessful in one course, they could transfer to the other campus and just pick up where they left off and not have to wait an entire year. The distance between these 2 campuses is 9.5 miles, so it would be an easy commute for the students. Both of these new campuses are complete with support services and libraries. Right now, we've had an incredible amount of interest without even advertising. We already have 75 people who want to apply. And we have a large number of qualified faculty. We have 19 applicants for 3 full-time positions to start. The Allen Technical Campus has 2 dedicated 10-bed nursing labs with mannequins and 1 simulation room with a high-fidelity mannequin. We also have a dedicated classroom just for the VNs with computer access for each student. The Wiley campus has a shared 10-bed nursing skills lab with mannequins and 1 simulation room with a high-fidelity mannequin. We will be sharing that with the CNA program. We meet during the day, they meet during the evening. We do have a dedicated classroom that is just for VN with computer access for each student. The core value of our college, which is creativity and innovation, we've really put to the test because of this COVID this semester, but I think we did a really good job. I would like to explain that we are using some creativity by initiating a concept-based curriculum for the vocational nursing program. Now, this is new to vocational nursing programs that we know of in Texas. but concept-based curriculum is used in the other Collin College nursing programs. And so since we are hoping to have this seamless pathway, we want to make sure that they are used to this type of teaching. With this type of teaching, if you're not familiar with it, the topics are grouped by exemplars instead of the traditional body systems. Now, the pathophysiologies are discussed from neonate age through geriatric age. Instead of having separate pediatric, med-surg, and geriatric courses, we cover the concepts through the entire lifespan. The focus on the exemplars, such as gas exchange, acid-base balance, or communication, just as examples, this allows for deeper exploration of the concepts that can be applied to multiple diseases. And it will develop the students' critical thinking and nursing judgment as opposed to just memorization. The goal with concept-based curriculum is that we develop a better equipped entry-level LVN with very good reasoning skills. The faculty, we have a faculty facilitated student learning activities planned for every single course. We will be using ATI just as supplemental materials to complement and reinforce the concepts presented in the classroom. And also, we will use ATI for standardized testing and data collection for our program evaluation purposes. Collin College has a state-of-the-art simulation center in McKinney with a dedicated simulation staff, and faculty is trained and certified in simulation. We have been lucky to have clinical sites that are interested in having us come to their facilities. We have 4 skilled nursing facilities, 1 rehabilitation hospital, several acute care hospitals, which we will use in the summer because we don't really want to compete with the ADN and BSN programs. So we will be mostly in the acute care hospitals during the summer. We will have experience with hospice, home health agencies, and 2 independent school districts. The cost of our program, first, before I talk about the costs, I want you to know that the Collin County taxpayers voted in a bond in May of 2017, a $16 million bond just for the college, which passed. That has paid for the buildings and the equipment. So that has all been purchased and paid for. The personnel cost for the first 3 years of our program is estimated at $1.47 million. That would be the director, 3 full-time faculty, and 5 part-time faculty. Our supplemental and professional development professional development budget for the first 3 years is $40,000 for a total cost of $1.5 million for the first 3 years. We have 3 sources of revenue. We have tuition and fees, we have property taxes, and we have state funding. We are very fortunate to have an abundant amount of taxpayer money that comes in. This is why our tuition and fees are so low. The college has agreed to cover any shortcomings in order to develop the program, because as you know, state funding can sometimes be delayed for the first 2 years of a brand new program. And do you have any other questions for me?
Are there any board members that have questions? If you please will unmute and recognize yourself.
Hi, Kathy. This is Carol Hawkins. Can y'all hear me?
Yes.
Yes, ma'am.
Okay. Just one question. The concept base, I was listening, but may have just didn't hear you. So the concept base, you're currently using it in your other nursing programs?
Yes, ma'am.
Okay. And so the faculty that's going to be teaching the VN are familiar with that type of curriculum?
Yes, and anyone who's new, I will definitely be mentoring.
Okay, so is there training in place for those new faculty coming on board that may be only exposed to the traditional VN curriculum type?
Yes, I have that developed.
Okay.
as part of orientation.
Okay. That was my question. Thank you.
Thank you. Anyone else? Any other board members? This is Kathy Ship, and I was wondering what your tuition was. You had talked about the financial, but you said it was the lowest in the state.
Yes, ma'am.
And what is it?
It's $52 per credit hour.
Okay.
Dr. Leach, would you like to add anything?
No, I think you did a great job. We're just super excited to have an opportunity for the students to have this. Sometimes the entry into nursing is complicated, and it's a great way to get your foot in the door and see if you want to be a nurse. And then we'll support your efforts if you love it, so that you can eventually become a registered nurse. So we think it's a great entryway and a great pathway for students that are struggling to decide what they want to do when they grow up. So we love it. We're excited.
Thank you for that. It looks like you've put a lot of work into it. Any other questions? Okay, Kathy Lederhorn, can I get a motion on agenda item 3.2.10A?
Good morning. I'll make the motion with pleasure. I would like to motion that the staff of Collin College, I keep saying, want to say Collin County, but of Collin County to approve, to set in motion for agenda item number 3.2.10A.
Okay, so that
I'm sorry,
grant would,
Ms. Lederhorn. Could you repeat that motion? I wasn't really clear on it. I want it to be a little bit clear for the record, if you would, please.
can you go to board docs?
And I feel like you're muted now, Ms. Lederhorn, so.
I apologize. I'm back. Okay, thank you. I'm so sorry. I move to grant the initial approval to Collin College to establish a new vocational nursing education program in McKinney, Texas, and impose the condition and requirement in the attached board order.
Thank you. And Kim Wright, do I have a second?
Yes, ma'am. Second.
Thank you. Having a motion and a second, we will now take an oral vote. Allison Porter Edwards,
4.
Diana Rodriguez Flores,
4.
Carol Hawkins.
4.
Can't hear you. You need
4.
to. Thank you. Kathy Lederhorn,
Kathy Lederhorn, 4.
Maisie Jamison, Maisie Jamison.
4.
Thank you. Tamara Rhodes,
4.
David Saucedo,
4.
Melissa Scott,
4.
Francis Stokes, can you unmute? Can you unmute?
4. Can you hear me
Great.
now?
Yes. Rick Williams,
4.
Kim Wright,
4.
and I'm Kathy Ship, 4. So the motion passes. So congratulations. We look forward to seeing all that product from all your work.
Thank you so much.
Thank you. We appreciate the vote of confidence.
Great job.
Thank you, Jane Lopes. Good job.
Yes. Okay. Now we will consider agenda item 3.2.10B, consideration of proposal to establish a new education program submitted by Aspen University in Austin, Texas, baccalaureate degree nursing education program. So Dr. Ayers, are your people on?
I see Dr. Ann McNamara. Is Dr. Rhonda Winiger here?
I saw, yes, she's there.
Okay, thank you.
Great, thank you. This is public hearing for a new nursing program. Under section 301.1457 of the Texas Occupations Code, the Board of Nursing is charged with the responsibility to prescribe and publish the minimum requirements and standards for a course of study in each program that prepares registered nurses or vocational nurses. The board has received a proposal from Aspen University to establish a new nursing education program in Austin, Texas. The purpose of this hearing is to allow an opportunity for interested parties, individuals, and organizations to present testimony to the board in order that it may determine whether the proposal from Aspen University will meet the minimum requirements established by the board. Members of the public were provided prior notice, both on file with the Secretary of State's office and on the board's website, of the opportunity to request to present verbal or written testimony related to this hearing and the instructions for doing so. Board staff has received no such requests. The proceedings this morning will be presented in the following manner. Persons who will be presenting on behalf of the nursing education programs will be given 15 minutes to make their presentation. Please make your comments as concise as possible. At the beginning of your remarks, please tell us who you are and who you represent. If you're addressing particular parts of the proposal, please identify them before you begin. If you wish to submit written testimony or to supplement your oral remarks with written testimony, you may do so at the close of this hearing by submitting those comments to board staff via email. Will the representatives of Aspen University Nursing Education Program raise their right hand and be sworn in? Do you solemnly swear or affirm that the testimony you're about to give before the Board of Nursing is the truth, the whole truth, and nothing but the truth, so help you God? Okay, Ms. McNamara, I cannot hear you. Can you unmute? And Ms. Winiger, Dr. Winiger, did you say yes?
Yes, I do.
Okay. Okay, great. I heard both of you. Thank you. Now the board recognizes Dr. Virginia Ayers.
Thank you, President Ship. Aspen University is requesting approval to establish a baccalaureate degree nursing program, a BSN program in Austin, Texas. Aspen currently operates a generic BSN program in Arizona, as well as RN to BSN, master's, and doctoral programs in nursing. Aspen has approval from the Texas Higher Education Coordinating Board to award the BSN and has achieved National Nursing Accreditation by the Commission on Collegiate Nursing Education, or CCNE. Although this request is specific to Aspen University, I need to pivot for a moment and discuss National American University. As you are aware, National American University, or NAU, elected to close its nursing education programs throughout the country. And the NAU facility in Georgetown is engaged in a teach out. Initially, Aspen's BSN program will be located at the NAU campus in Georgetown, as Aspen is assuming NAU's lease at this board-approved facility, including all of the inventory. The facility is fully equipped for BSN education and more than adequate to house the new Aspen BSN program. Eventually, the Aspen University program will be located at 101 West Louis Hanna Boulevard in Austin and will occupy an almost 20,000 square foot area. After the Aspen BSN program moves to this new location and prior to any student enrollment, board staff will conduct a survey visit to determine alignment with board rules. The Aspen BSN program is comprised of a total of 120 semester credit hours, including 41 semester credit hours of general education courses and 79 semester credit hours of nursing courses. Full-time students can complete the program in 3 years. Didactic content is offered via distance learning. However, the seminars will be delivered face-to-face. Each cohort in its entirety will attend seminar courses, which will meet face-to-face for 3 hours every other week during an 8-week session. Clinical learning experiences appropriate to BSN level students have been secured with the Baylor Scott and White healthcare facilities in Central Texas. Students will be provided a variety of acute, post-acute, chronic, critical care, medical, surgical, and community health settings and services. Dr. Rhonda Winiger is the proposed director of the program, and she is currently serving as director of the NAU BSN program. Dr. Winiger has been a professional nurse since 1991 and a nurse educator for more than 10 years. She has served as nursing faculty in associate degree, baccalaureate degree, and nursing graduate degree programs. Dr. Winiger has served as a dean and program director of nursing education programs in Texas. Aspen is requesting the admission of one day cohort of 30 students in September 2020 and one evening cohort of 30 students in December 2020. Aspen is requesting a continuing admission of 30 students in 4 admission cohorts per year. In 2021, 2-day cohorts of 30 students each will begin in February and October, and 2 evening cohorts of 30 students each will enroll in April and December. And again, prior to student enrollment at the new Austin campus, board staff will conduct a survey visit to ensure alignment with Rule 215. I would now turn the meeting over to our 2 representatives from Aspen University and ask them to introduce themselves and share further information about the proposed program. Thank you.
Good morning, everyone. My name is Rhonda Winiger, and I'm the proposed director of the BSN program. I'm very excited to be here today to discuss Aspen University's new BSN nursing program.
Dr. Winiger, can you increase your volume? We're having a hard time hearing you.
All I'm not sure how to do that. I'm on
That's
the
better. That's better.
Okay, let me just sit closer to the phone. I'm going to start over. Thank you, Dr. Ayers, for that discussion and the introduction. Good morning, everyone. My name is Rhonda Winiger, and I'm very excited to be here today to discuss Aspen University's new BSN nursing program proposal for Austin. I would like to say a special thank you to Dr. Hooper and to Dr. Ayers for all of their advisement and assistance with the development of this proposal. As mentioned, I have been a registered nurse for 30 years and working in the nurse education field for 20 years. I was approached by Dr. Ann McNamara, who is the Chief Nursing Officer of Aspen University, about opening this BSN program last fall. I started researching Aspen University, and I was very excited with what I had found. I love it that the focus of Aspen University is affordable education. The cost is less than $50,000 from start to finish. Students are also not required to buy as many textbooks because the textbooks are built into each course. Students do have to buy the APA book and a few little books, but the majority of the courses have an e-book built into it. I was also intrigued that all the lecture courses are developed and offered online, especially in the times of the coronavirus. They already had a leg up on everyone. All of their lectures were already online. As mentioned, the students do continue to go to clinical and they come to campus for their labs, but they also come for the seminar, which is new and innovative. The seminars are state of the art and they incorporate the nurse of the future competencies, which align very well with the decks. An example of this seminar approach, and as Dr. Ayers alluded to, it's a half a credit hour for each lecture course, and the students come on campus every other week for 3 hours. So say the student was taking pharmacology, they would still do their lecture, they would still do their labs, and then they would come in and build on that didactic knowledge that they got from the lecture and the lab, and they would just bring it all together and align those learning objectives of quality, safety, professionalism, communication, teamwork, and some collaboration. So some other key components of this proposed nursing program are: one, we do have CCNE accreditation. We participate in SARA. We have entered into a collaborative agreement with Baylor Scott White Healthcare for our clinical placement, which is wonderful. So we have clinical placement. Finally, as Dr. Ayers mentioned, we're filling a void in the nursing education in Texas since National American University will be closing and graduating their last cohort of students in February 2021. And another reason for us taking over NAU's campus is that site has already been approved by the Board of Nursing, and they're unable to make site visits at this time. We already have all of the equipment in place, the mannequins, and we're also filling a void for the employment of those nursing faculty that are being displaced with the closure of NAU. I want to thank you for your time and attention, and Dr. McNamara and I are ready to answer any questions that you might have.
Thank you, Rhonda. I think just by way of introduction, let me introduce myself. My name is Dr. Ann McNamara, and as was shared, I'm the Chief Nursing Officer at Aspen University and have been part of Aspen since 2017. I was invited in 2017 to actually build and develop this curriculum for Aspen, and I just have to tell you, it's an amazing opportunity when you can have 30 years of experience behind you and have the chance to say, okay, go ahead and do what you believe is the best BSN education that can be possible. So knowing that, and then I was previously the Dean of Nursing at Grand Canyon University in Phoenix, Arizona, and I was also the academic president of Collin College, which has 4 campuses around the country, one being in San Antonio, Texas. So it was wonderful to have this chance. And through a colleague, I learned of NAU teaching out its BSN curriculum. So that's why I reached out to Dr. Winiger, and we kind of hit it off. And she's been a wonderful partner and collaborator as we've been unfolding this BSN for Austin. And the other, I guess the other thing I would like to say is that We're just so excited to have Baylor Scott and White Central Texas Division as our partner. I had an opportunity to work with Rosemary Luguire, Dr. Luguire, on some national committees. She introduced me to as she transitioned out, introduced me to new leadership at Baylor Scott and White. We've met many, many times, and with their building new hospitals in the greater Austin area, they asked us to open this campus in Austin versus someplace else in Texas. So I'm excited and available for any questions that you might have of Rhonda and I. Thank you.
Thank you. Thank you very much. Are there any questions, board members?
Madam President, I have a few questions.
Dr. Edwards, yes.
Dr. McNamara and Dr. Winiger, good morning. So I looked at the Arizona campus, and my understanding is that Aspen University in Arizona has not realized their first set of NCLEX scores. Is that correct?
That is correct. The first group graduated last week in July.
So that won't be realized till maybe the end of this month, next month, depending on their availability, accessibility to Pearson VUE or whatever proctored center.
That is correct.
Okay. And then Aspen University, is it a publicly traded NASDAQ company?
Yes, it is.
And will the chairman of the board reside in New York? Because Mr. Matthews currently is the chairman of the board, and this is based out of New York, the parent company.
Mr. Matthews has recently purchased a home in Arizona, and so he does have a residence in Arizona.
Okay. I also, thank you, also noticed that your entrance GPA is 3.08. Can you tell us a little bit, no?
No.
That's for Arizona.
No, the GPA requirements as put on our website are 2.75, and students have to pass the HESI A2 in English, math, and A&P. What we've realized is in Arizona that the GPA has elevated as new student cohorts have started. So the average now is 3.08, but that's not the requirement.
Gotcha. Thank you. And then I also noticed on your Arizona website that proctored exams, that students may take them up to 4 times. Is that correct?
Well, it depends. We're using the HESI content. As Dr. Winiger alluded to, we've created a national relationship with Elsevier, and so that gives us access to all of their content exams. I think there's only one exam in the curriculum where we allow up to 4 times, and primarily that would be the RN exit, so that students can be taking that toward the end of their program of study. So, but students are allowed to take it, and it's usually 3 times to meet the benchmark. So if they're in their maternal child, they're taking their coursework, and then we do have a proctored exam where they would take the HESI maternal child. So that's how that, we've just incorporated that into the program of study, but we do not use it as a, as a stop to continue, because we believe that it's our curriculum that should really move the student forward and not a nationally based exam. Does that make sense? Some schools I know use the content exams as a stop, that if you don't hit a certain benchmark, you're not able to continue in the program. But if the student has met all the criteria for the class and has taken the benchmark, has taken the HESI, we give them a certain number of points inside the course, but we don't stop them from continuing.
Yes, Dr. McNair, I'm very familiar with Elsevier products. I was glad to see that you all were subscribing to all of their products. We use all their HESI exams at our college.
Yeah.
And for each of the core content and curriculum subject courses. So, and we do it similarly with the points, but the exit HESI, they're only allowed to take twice until they have to matriculate again through one or two of the courses. So it's not a stop point, it's a reevaluation point for us, but we only let them do that twice, not 4 times. That just seems a bit excessive. And with that comment, I also noticed that you tout appealing to a different demographic, tout being affordable, and as Dr. Winiger mentioned, and as the website says, the tuition for Phoenix ranges per credit hour from $150 to $495 per credit hour, which culminates to about $45,000 in books, fees, and so forth. But I don't know, it's just a bit concerning that the 4-time part, that's worrisome. And then the other question I have is, if Dr. Winiger is leading this teach out right now, can Dr. Winiger maybe tell us about the deficiencies that led to North American University and how that's going to be different for Aspen?
Hey, I'll take that question. Thank you for that question. That's a very good question. It's National American University, not North American University. And the board at National American University was looking at financial sufficiency, and they decided they wanted to go to an all online program. And you know as well as I do that pre-licensure programs need clinical, they need simulation, and it was just not a model that they wanted to support anymore. So they decided to close over 50 ground campuses to maintain financial solvency. And I currently have 12 students that are in that last cohort to graduate in February. National American University has stood behind all of the students and even is taking a large financial hit to maintain and see these students through the entire way. We have graduated all of our MSN students. We have one RN to BSN student left in the program. So we are maintaining everything that we can to make sure these students are successful. So it wasn't anything about, we have full CCNE approval. It was nothing about the state of the program. It was a financial decision from the board members. It had nothing to do with the nursing program. Did that answer your question?
That did, Dr. Winiger, but it leads to another question, if you don't mind. So will you have an advisory board that resides in Texas? Mr. Matthews purchased a home in Arizona, but as the CEO, but will you have an advisory board or faculty assembly or some sort of governance in Texas?
Yes, certainly. Once we receive board approval, I will start an advisory board to get more input about nursing programs in the state of Texas, as well as programs in Austin, as well as clinical. I'm very familiar with advisory programs or boards. And also, I forgot the second half of what you said.
Just if a board will reside, you've answered it. You're going to put one together upon board approval.
Right, right.
Then just for clarification, National American University, they were purchased by Aspen, is that correct? No?
No, National American University, we did a lease agreement with Aspen University that they would take over our lease at our campus site, and they took over our medical equipment and office equipment as of August 1st. So if Aspen University gets board approval, it's a streamline where they're just going to move into our campus while their campus is being built out.
Thank you.
Hey, this is Tamara. I have a couple of other questions. Can you guys hear me okay?
Yes.
I agree with Dr. Edwards regarding the frequency and the number of attempts that students are getting on the HESI exams. I'm wondering, you said there's a point system for the in-class HESI exams. Could you guys explain that point system and how that is incorporated into their grade?
Yes, I'll do that. Thank you. First of all, I do want to, Dr. Edwards, there's only one time that we allow the students to take the HESI 4 times. All the other courses, it's only twice. So I want to just make that correction. But we do allow them to take the predictor up to 4 times to get the practice. And then we've incorporated the CAT, the computerized adaptive test that Elsevier has created in coordination with NCSBN. And that actually is the final test that they have to take. And 100% of our graduates did pass that at the benchmark. So just to answer that question and bring some clarification. So Dr. Rhodes, tell me, so I hope that helps you understand that, but what was your other question?
I was wanting to know exactly how the point system is.
Oh, thank you.
Incorporated.
Okay, sure. So inside the course, if the student hits the benchmark for the first time, they get 200 points. If they hit it the second time, they get 100 points. And then after, if they don't hit it, they get 0. So they could get 0 points if they don't hit the benchmark.
And what is your benchmark?
850 for the beginning courses, and then 900 for the exit. We're just using the guidance from Elsevier as far as best practice.
So in these courses, you're giving them 3 attempts each time they can have an opportunity for points.
Say that again.
So during each course, they have 3 attempts other than the final.
No, they actually have 2. They have the first to hit 850. If they hit 850 on the first attempt, they get 200 points. If they hit 850 on the second attempt, they get 100 points. So they don't get the full points. If they don't hit that, they get 0.
Are you
points.
requiring, do you require all of your students to take the second attempt, or just the students that don't meet benchmark?
Just the students that don't meet the benchmark.
Okay, are you given the same exam, or do you have different versions of this exam?
Different versions, ma'am.
Thank you.
Are there any other questions, board members?
Yeah, I have a question, or more so just a comment.
Mr. Sacedo?
Thank you, Madam President. I always like to, always look out for the students, et cetera, and I always look at reviews of programs, et cetera. And did you all know that the #1 trending search on Google for your school is literally this? It says, "Is Aspen University a joke?" That's concerning. Second, you start looking at some reviews of some students. Some students, it seems that the common denominator here with the program offerings across the board here is busy work, is lack of attention, as well as easy A's. And the reason I'm concerned about that is that, as we all know, the NCLEX is extremely difficult. I would hate for student, regardless of the price of $47,586, or roughly that amount, I would hate for a student to feel like they're doing so well, because again, there seems to be this perception of easy A. They are paying for this. And I guess my question is, are you all familiar with what's going on with the reputation you all have online? I mean, obviously it's definitely concerning for us, especially again, as a university that really doesn't have a footprint in Texas just yet. And this is what's going on. So if you could perhaps just address these concerns.
I'll go ahead and address that. Thank you, Mr. Sacedo. So first of all, I'm not familiar with that because we do And as you know, anybody can put anything they want online. But we do regularly do student satisfaction. We do check in with our students. I would say we do have grade variation. And so I don't know exactly what programs those students are coming from, but part of what we've heard primarily from students is the fact that all the post-licensure programs are designed so that students can do a monthly payment plan and not get themselves into debt, which is a very important value of our CEO. And also the fact that what we've heard from our current ESN students that are going through the program in Phoenix is that it is rigorous and they have to do a lot of work. And there's high expectations of of what's expected of them. This cohort that just graduated started with 26, it's finishing with 20, and 2 of the students are coming in one class behind. So, the retention has been good with those students. So, I mean, I have to tell you that I have not looked at the Google remarks, and I'm not saying that's not what is out there, but I think there's equally very, very good reviews of our program and what students are getting for, I guess, for their education. So
I would like to expand on that. As being a dean of a university or a dean of a nursing program that's nationwide for a proprietary school, there's always going to be students that are not successful and that are going to go on and put down a review on Google. Nursing programs are very rigorous. They're very standardized. There's going to be students that aren't successful, and by no means is it busy work. Currently in the program that I'm teaching in, students will complain and they think everything is busy work and they don't understand why they're doing it. And certainly if a student was given the opportunity to not take classes and to just test out of a class, they would certainly do that. So I don't think we can say that our nursing program is busy work. And I mean, we always look at student reviews after a course, but I think you have to take that with a grain of salt because it's a new nursing program. We're just starting the nursing program. And I'm not sure what these reviews are. I would like to look at these reviews, but at no time would I discount it and say that it's a lackluster education based on reviews. So I would say let's wait until we have this first group of class, take their NCLEX results, and I would go more by NCLEX reviews than disgruntled students who are posting on Google. Does that answer your question?
Well, I mean, the fact that you brought up that you guys are familiar with the critique of it being busy work, I've never, in the last 6 years I've been on the board, I've never read a review where a student complains of busy work. I mean, that is first. And then I'll just wrap up with this. In addition to, is Aspen University a joke? The next searches are, is Aspen University a diploma mill? Is Aspen University nationally accredited? Is Aspen University a good nursing school? So the point that I'm trying to make to you all is that I'm here, my role, right, is to protect the public. And it seems that, again, there's some type of reputation that is following this program, and it's following them, and it's coming into Texas. I have concerns, obviously, on the academic side. Dr. Allison Porter Edwards had some concerns there, as well as Tamara. And I'm coming from the other side, on the consumer side, and I do have some serious concerns about this program, and I don't know if I agree with you. Of let's get this program here first to see how we do. I don't know if I'm there yet.
I didn't say let's get this program here first to see how we do. I said let's look at the group that just graduated last week to see how they do with their NCLEX scores.
Okay, Dr. McNamara.
So I've just jumped on to take a look at the Google reviews that you're talking about. And as I go deeper in and start reading, I can see that there are some disgruntled students. But I'm also seeing that many of these comments are coming from the graduate programs and some of the online programs, but in business and not just all nursing. So I'm just going to tell you, I want to assure the board that we put students first. We listen to our students. We respond to our students. We are not a joke. We are a reputable nursing school. I mean, I understand that my reputation and the reputation of all the faculty and everybody, I don't think Baylor Scott and White would join us in this partnership if they thought that our school was not a reputable program. So I do want to assure the board that we are a good school. We are not just letting things go willy-nilly. We are rigorous, and I think we can get testimonies from students that are in the program and finishing the program. And I think, as Dr. Winiger said, I'm confident about the NCLEX scores that we're going to see coming out. And I would say to the board that you're not taking a chance on a program that's not been tested. We are true, tried and true to our curriculum. We did make changes and improvements along the way, which you would expect of any new BSN program. But I am confident in what we are bringing forward to the state of Texas.
Madam President, may I make one more comment?
Yes, was that Dr. Edwards?
Yes.
Yes.
Dr. McNamara, the consumer reviews that I was reading were from grade reports, just for your information. And one of them that concerned me the most didn't have to do with the busy work, but the complete absence of an instructor. And that was in the BSN program. And this consumer said that it took them 2 years to complete a BSN program and or your BSN program, and that there was the absence of an instructor in a course whereby they had to track down a counselor to advise them that yes, in fact, there was some confusion that there was not an instructor. So that's a serious logistics issue that, of course, students complain about everything, but the absence of an instructor or communication about an instructor teaching a course, that's serious. Are you aware of that incident or anything jog your memory about that occurring? That was posted on May 18th of this year, so that's very current.
Right, I'm looking at grade reports right now, Dr. Edwards. So let me just share with you the system that we have in place for assuring that faculty are, one, in the classroom, responding appropriately, and we have set standards that for if you're teaching in the online program, what you must meet. And and we did share that with the board staff as far as how faculty are evaluated. And that is done on a regular basis. So there's, and it's an external person, it's not within the school, it's somebody else that goes into the online classroom and does look at that. The faculty are not responding to students and are not appropriate in their comments, then they are counseled immediately to, to whatever the issue and problem is. So we do have that system. I'm looking at the grade report. Okay, the one that was on 518, it's an RN to BSN student, and I see the complaint of what's put on there, and I would say that I don't know that incident, but I see what you're seeing, and we do have systems to catch that and to make sure that those faculty, one, if they're not in the classroom and doing what they need to be doing, then another faculty member might be assigned. The program director might have to jump in and teach if there's something's happened, but that is really not an acceptable standard that we have for our faculty at Aspen.
Thank you so much.
I would just like to expand on that and say that I have served as a BSN program director in Austin, Texas, and I'm on top of my instructors. I'm in their courses. I go in and make sure Their grades are being inputted. They have to put in attendance within 4 hours of that class being started. We have financial advisors and academic advisors that follow those students, because you and I both know that if the students are not attending class, then they cannot get their financial aid. So if attendance is not inputted, then that could affect the student's financial aid. And again, these students are going to be on campus every other week in a seminar and simulation. I will be on campus. I have an open door policy with all of the students. If there was any type of issue like this, I would be on top of it. I have not had a situation like that occur in all my years of teaching. Like I said, I have been a dean of a national nursing program with campuses throughout the United States. And if I receive a student complaint, I always investigate it thoroughly and act on it appropriately. But I would not tolerate that.
Thank you.
Are there any other questions, board members? Or Dr. Winiger or Dr. McNamara, anything else you have to say? Okay. Okay, great. Thank you. Thank you for responding to our requests. So, Ms. Flores, could I get a motion on agenda item 3.2.10B?
Madam President, I move to grant initial approval to Aspen University to establish a new baccalaureate degree nursing education program in Austin, Texas, and impose the conditions, requirements in the letter and board order.
Thank you. And do I have a second, Ms. Wright? Can you unmute? I think you're muted. Okay. Okay, she can't unmute.
That's right. You can't hear us though, is that correct? Not if you can hear us, yes.
Okay, so I guess I need a second from someone else because we can't hear her. Okay, Ms. Scott, can you unmute?
Yes, I will second that. This is Melissa Scott.
Okay, thank you. Okay, having a motion and a second, we'll now take an oral vote. Dr. Edwards?
Against.
I'm sorry, Diana Rodriguez Flores?
For.
Carol Hawkins?
Against.
Kathy Lederhorn?
Kathy Lederhorn, for.
Maisie Jamison?
Maisie Jamison, against.
Tamara Rhodes?
For.
David Saucedo?
Against.
Melissa Scott?
For.
Francis Stokes?
For.
Rick Williams?
For.
Kim Wright?
Kim, if you are voting for, you can do a thumbs up, and if you're voting against, you can do a thumbs down and make it a visual.
Okay, down, against. And Kathy Ship, for. So we have 7 for and 5 against, and the motion passes. So congratulations to your school. And I think we've had some good discussions here, and I think some things for you to think about as you're launching this new program. And our educational consultants still will be working with you. And you know, we're for the students and for the public, and we want good nurses. So thank you for your time today. And then Dr. Ayers will talk to you. Thank you.
Thank you.
Thank you so much. We appreciate your vote and your attention.
Thank you. Okay, members, we're going to take a 15-minute break at this time, and then we will come back. So right now I have it's 10:29, so we'll come back at 10:45. the Texas Board of Nursing quarterly meeting. And the next item for consideration is agenda item 1.1, Executive Director's Report. Ms. Thomas.
Madam President, can you hear me?
Yes, I can.
Good morning, Madam President, members of the board. You have my Executive Director report. Today, I would like to provide you a summary of the board actions in response to the COVID-19 disaster. As everyone is aware, the governor declared a disaster in Texas for all 254 counties on March 13th of this year. On the 14th, Governor Abbott directed the Board of Nursing to fast track the temporary licensing of out-of-state nurses to assist in the response. The board adopted the policy that any nurse coming into Texas for the purpose of rendering aid, provided the nurse holds a current license in good standing in their home state, was eligible to render such aid. The disaster declaration has been renewed every month since the original declaration and was last renewed on July 10th of 2020. The waiver eliminated license reactivation fees first, and that was an additional waiver granted by the governor. That eliminated the requirement for license reactivation fees, CE requirements, refresher course requirements, and jurisprudence requirements for RNs and LVNs. And to this, I'm sorry, I started to say to this date, on July 17th, we had approved waivers for 793 LVNs and 1,533 RNs. Another waiver by the governor permitted APRNs to reactivate their license if they had been inactive less than 4 years, and that waived the reactivation fee, CE requirements, and current practice for APRNs. Since that time to July 17th, the board has granted 43 waivers for APRNs to renew their license. A later waiver granted by the governor allowed APRNs who have met all the licensing requirements except for national certification to begin practicing under direct supervision. It does not include prescriptive authority. The governor also granted a waiver that created a grace period for license renewal for 6 months from March through September. So anyone who renews in that period has until the end of September to renew their license. The governor also granted a waiver to extend GN and GVN permits by 6 months, and that applied to any permits that were issued after March 21st. Normally, there's a period of 75 days where the permit is active. And also, the governor allowed students in their final year of the program to meet objectives through greater than 50% simulated clinical learning experiences. To help those students who are having trouble finishing up their program this year to graduate and contribute to the disaster relief. The governor also granted a waiver for APRNs to prescribe pain medication refills by telemedicine during the pandemic. That was extended one time, and when that waiver expired, the board adopted an emergency rule to extend the waiver for APRNs prescribing pain medicine under physician delegation by telehealth during the pandemic, and that was extended one time by the board and is currently in effect. All the other waivers granted by the governor will be in effect for the duration of the disaster. All the waivers resulted in instructions being added to a new page on our website, the COVID-19 webpage. That webpage contains information on these various waivers and conditions for licensure. Internally, some of the other initiatives that staff have undertaken in response to the disaster, the office was closed to the public for the safety of staff and the safety of the public. Staff were moved home to work remotely. There are very few staff who come in daily and a few who rotate in the office to pick up paper files, scan and send documents to other staff, and conduct other business that can't be performed at home. We relocated the call center staff to home with headsets and computer equipment. They're able to take those calls from home just as they did here in the office and respond to questions and concerns of consumers. We canceled our workshop, Protecting Your Patients in Your Practice, Nursing Jurisprudence and Ethics, in May, and changed the June workshop to a virtual workshop to protect staff and participants. We prepared virtual new orientations for deans and directors of new programs. That one was held on June 5th of 2020. We created a formal process for conducting a virtual survey visit. None have been conducted so far, but we expect them to be conducted on the new programs and perhaps others going forward. We held a webinar meeting with program directors on April 17th to answer their questions, to share some of the experiences of other programs who are finding clinical experiences out there, and to explain the waivers. A special edition of the education newsletter was sent out to all programs in March of 2020 to explain the situation. Investigations have been continued to be conducted through telephonic interviews and the review of subpoenaed records. Case reviews are developed and forwarded. They have available to them informal settlement conferences. Those have been transitioned to virtual meetings with respondents and their counsel. Attorneys, investigators, and practice consultants have been participating in mediations and formal hearings through the SOA's virtual processes. SOA also required e-filing, which is a special program. They launched it in March of 2020, and it requires all filings be done electronically. We made changes to our disaster plan, and we will be submitting those to the State Office of Risk Management to explain what we have learned during the process and how the plan should reflect that. IT has posted many updates and kept the COVID site up to date. They've also provided a lot of staff support to people at home who are having difficulties with signing into our system. Our eligibility and disciplinary committee meetings and full board meetings have used phone access, and now this is our first video access meeting. All applicable state laws, including waivers to the Open Meetings Act, were followed. The executive director has participated in many weekly calls with government affairs representatives from various state agencies, licensing agencies that include all the health professions agencies, as well as TDLR and many others, such as the plumbers, real estate commission, land surveyors. We've also participated, or I have, in the CEO EO calls with National Council, where we get updates weekly on the status of the NCLEX exam. And there have been some meetings of nursing groups that we have participated in as well. The directors and I have met weekly through the COVID disaster and throughout the week. These meetings have been really valuable for us because we've been able to share more in real time some of the things that we're learning, some of the challenges that we're experiencing. We've also developed a return to work plan. This plan reflects the Centers for Disease Control and DSH's policies related to safety in the workplace. And that work plan is ready to go when we are, but at this time we maintain our telework policy that we initiated with the beginning of COVID, and that is in effect at this time through September and subject to change after that time. This transition all happened during our peak graduation time in May, which had a real burden for, I think, our licensing staff, everybody throughout the agency who's involved in licensing and responding to phone calls from people. In addition, we launched ORBS June 15th of 2020. You'll hear more about that from Mr. Mayak later in the program. These particular programs required all hands on deck during the process, and it was something I think staff have lived up to and worked very hard to respond to. I appreciate all their efforts. This past period since the disaster, we have experienced some slowdown related to the exams. The exams have been Initially, the centers all were shut down, but that didn't last very long. They've been opened up, but in order to provide the social distancing requirements in various jurisdictions, they have honored those, and those have required the fewer people to sit for the exam at any given time. They also lost a lot of staff at the Pearson View centers, and so those staff have been slowly rehired with new staff. Their goal is to get up to 800, and they're currently at 600 staff, temporary staff on board. In addition to the reopening plan, we have worked with purchasing to obtain all the signage, the thermometers, the personal protective equipment, cleaning supplies, and all of that will be required for reopening the office. In addition, HR has surveyed all of our employees concerning their satisfaction with telework and their concerns about returning to the office, and all that's been taken into consideration as we developed our policies. We will be ready to return to the office when state leadership directs us and the pandemic conditions are improved. We'll remain teleworking until that time. This will be remembered as a year of great challenges to the public, to healthcare providers, and to state agencies. The disaster itself has had devastating effects on the physical and mental health of many Texans. Healthcare providers have been challenged to care for very sick patients who weren't permitted to have visitors most of the time. We're hearing a lot of stories from them. And state agencies have operated remotely with limited equipment and experience with telework on such a large scale. So it's been a phenomenal achievement, I think. We have learned a great deal through the process. And when the disaster ends, and it will, we will evaluate our experience, and we're going to consider all the changes to operations going forward. We're really not ready to commit to any changes right now, but we're taking all of that into consideration when we evaluate and develop policies for our staff and their work arrangements. So I'm happy to answer any questions that the board members may have about this report.
Madam President, this is Kathy Lederhorn. May I ask a question?
Yes.
Thank you. Ms. Thomas, I was just wondering, anecdotally, I'd heard some information that some other states, their Pearson View is still not where it should be, and they're coming into, compact states and whatnot, and then returning to theirs. Has that been a good number or no?
I will ask Mr. Mayak to respond to the numbers. I don't think it's been huge, but there has been some of that, I know.
Good morning, Madam President, board members. In response to that, what we are seeing is that the majority of applicants for Texas have been able to schedule through August and early September, so we're still in good shape. And the council provides us information. We're probably within 2%, less than 2%, having our applicants further out. So we're in pretty good shape here, especially since they expanded their centers to 100% and in San Antonio and Austin. That really helped us out here in Texas.
And Mark, are you aware of any or the numbers of people who are coming from other states to test in Texas? Have you seen a trend in that direction?
No, ma'am, not at this time.
I was on the president's conference call in the last week, and Phil Dickinson talked about that. And one of the things they did is they shortened the test. The test had been at 6 hours, and they shortened it to 4 hours, and it still has the same reliability that it had from the 19 numbers, and it's still holding true to that. And so what they've done then is given us so when before they would have needed 12 hours to get 2 groups of people in, now they need 8 hours. And they've also extended some of those sites to 12 hours a day so they could get 3 groups of people in and still do the social distancing, which eventually allowed them to be able to do enough like they normally would have if they hadn't been social distancing in the 6 hours. And so that has made a huge difference in the numbers that are being tested.
Do y'all anticipate that they'll stay at the 4 and not return to the 6, or go back to the 6?
Ms. Lederhorn, this is Kathy Thomas. They have a plan to continue the 6 for a while. I mean, 4 for a while. Eventually, it will return. The only thing that changed about the exam in that regard is that the items that were experimental, optional, were included before, and they're not now. There was an effort just to decrease the time in order to allow the graduates to test as quickly as possible.
Madam President.
And Phil Dickinson just said that it is, you know, the reliability is excellent. Mark?
And I can also tell you that the Board of Directors of the National Council just recently voted to extend it to a certain time period. And we'll go back and you'll hear that at the Delegate Assembly, all that information next month. So they'll update you on what's going to happen in the future.
Great. Thank you so much.
Any other questions, board members? So I wanted to also say that Gina Abel, our Deputy General Counsel, and John Vanderford, our Assistant General Counsel, have now been added to our group. And then Dr. Hooper and Dr. Ayers have left the group as staff because they had taken care of the education items.
Madam President, if I may, David Salcedo, board member David Salcedo, lost internet connection due to weather in his area. However, he has joined the meeting by phone. So he is still able to participate in the meeting. He's just not visible to us.
I'm here. Some thunderstorms knocked out our internet in the area, so but I'm on the phone.
One of our challenges. Thank you, David. Okay.
No problem.
All right. That was an agenda item that is not for voting, no action required. And as we move down the agenda, 5.2 advisory committees and task force, there are no reports for the July meeting. And next we will consider agenda item 5.3.1A, National Council of State Boards of Nursing appointment of board members to attend the National Council State Board of Nursing annual meeting to be held virtually August 12th through 14th, 2020. Ms. Thomas, were you going to?
Madam President, I'm just prepared to make a couple of comments there. You do have the candidate slate attached to the agenda item. The annual meeting is going to occur only on one day. Now that it's virtual, it'll be on August 12th from 1 to 5 p.m. And this abridged meeting is going to include the delegate assembly, a candidate forum, a committee forum, and the elections. There will be no guest speakers. There are 1,000 seats available for the online meeting, and there are 131 remaining today. It's on a first come, first served basis, and there is no fee. So as I believe President Shipp has told you before, you can join the meeting. You just need to register. I'm happy to answer questions.
So for the voting delegates, it will be Kathy Thomas from staff and myself. And we usually have an alternate. So Dr. Benton will be Kathy's alternate. And I didn't know what board members were going to be on the virtual meeting. And so one of you could be my alternate if something happened and I couldn't do it, but I didn't know who was going to be on or would want to do that.
Madam President, this is Allison.
Mm-hmm.
I have registered for the meeting and I'd be happy to be your delegate.
Okay, great. So you'll be my alternate if something happens and I can't do it. Okay.
Sorry, wrong terminology, alternate.
Thank you. Thank you.
Board members, I just add one thing. On the delegate assembly agenda, there'll be 2 items for the vote of the membership. One will be on the elections, and the other will be on amendments to the APRN compact with two significant changes to the current APR and Compact to clarify that the exam that is required of applicants is a certification exam, and the other to require 2,080 hours of experience in order to obtain a multi-state license.
So what we will need is to have a motion for this agenda item, and that will be that giving us the direction to vote on those issues. So Tamara, can I get a motion on agenda item 5.3.1A?
I move to direct the delegates to vote on these issues after hearing and considering the discussion on the issues.
Okay, and Rick, can I get a second?
I second the motion.
Thank you. So having a motion and a second, we will now take an oral vote. Dr. Edwards?
For.
Diana Flores?
For.
Carol Hawkins?
For.
Kathy Lederhorn?
Kathy Lederhorn, for.
Maisie Jamison? Oh, can't hear you. Can you unmute?
For.
Great, thank you. Tamara Rhodes?
For.
David Saucedo?
For.
Thank you. Melissa Scott?
For.
And Francis Stokes?
For.
Rick Williams?
For.
Kim Wright?
For.
And myself, Kathy Shipp, for. So the motion passes. Thank you, members. At this time, we're going to move on to agenda items 6.9 and 6.10. So 6.9 is consideration of adoption of amendments to 22 Texas Administrative Code 217.4 pertaining to requirements for initial licensure by examination for nurses who graduate from nursing education programs outside of the United States jurisdiction, including written comments received and direction from Regulatory Compliance Division, Governor's Office. And 6.10, consideration of adoption of amendments to 22 Texas Administrative Code 217.5 pertaining to temporary license and endorsement, including written comments received and direction from Regulatory Compliance Division, Governor's Office. So Ms. Abel will present those.
Thank you, Madam President. Good morning, board members. These two agenda items are informational. As you'll recall, at your January 2020 meeting, the board approved amendments to these two board rules, 217.4 and 217.5. And as you'll recall, those board's rules had to do with the credential evaluation services that are currently utilized by the board to evaluate a applicant's foreign education to see if it's similar, substantially similar to a United States education, so that those nurses can become licensed. Those current rules only allow 3 credential evaluation services to be utilized. And the proposed amendments that you approved in January would open that up to allow additional companies to provide those services if they were approved by the board after meeting certain criteria. And some of that criteria was, as you'll recall, that they had to be in business for a minimum of at least 5 years, and that they would be able to provide good recommendation letters and good reviews from their customers, as well as demonstrating their expertise to provide the services. So those rules were published in the Texas Register in March. The board did not get any public comments on those proposed rules. And normally what would happen is if there were no comments, those rules would be adopted as proposed. As you'll recall, last session, there were amendments during the legislative session that formed the Regulatory Compliance Division of the Office of the Governor. And that office was formed to evaluate agency rules when there was a possibility that those rules could affect the marketplace, and specifically if they could have an anti-competitive effect. We have not yet had one of the board rules go through that process, but this rule 217.4 and 217.5 were pulled by the office, the Regulatory Compliance Office, because they felt like these rules could potentially have an anti-competitive marketplace effect based on the fact that credential evaluation services would have to be in business for a minimum of 5 years and meet these other criteria that the proposed rules set out. So board staff was notified by the office that they were going to be reviewing the rules. And that started in May. Staff provided information to that office, and they did also ask for additional information in June, which board staff responded to them. At the time that the reports were written, we had not received their decision. It actually came to us last night, and we were informed that they found that the proposed rules did comply with the public policy of the state, and that they were giving permission for the board to adopt those rules as proposed without changes. So staff will be sending those rules over tomorrow to the Texas Register as proposed, and those will take effect 20 days from tomorrow's date. And I'm happy to answer any questions that you might have.
Any questions, board members? Okay, no questions. Thank you so much. The next item for consideration is agenda item 7.4, consideration of proposed amendments to 22 Texas Administrative Code 217.23 relating to balance billing dispute resolution. Ms. Abel?
Thank you, Madam President, board members. This agenda item is to consider several amendments to the board's current rule 217.23. These proposed amendments are necessary because last legislative session, Senate Bill 1264 passed, and it became effective last September. That bill made sweeping changes to many provisions of the insurance code that relate to balance billing by out-of-network providers. And that bill was a consumer protection bill. It shared responsibilities for implementation among various agencies. So the Texas Department of Insurance has finally adopted their rules to implement the provisions of that bill. It also affects the Board of Nursing and the Texas Medical Board. The amendments that you have in materials.
Excuse me, Gina. Thank you. It appears on my screen that a few of the board members' visages have gone off, but they may still be able to hear. Does everybody else see that same type of issue?
No, everybody's there but David.
Okay.
I'm seeing it, and I think it might be something in our office that is doing that, Dusty. I believe it's our office network.
Very good. I just wanted to make sure that we still had contact. Thank you.
We have 12 on.
Okay, thank you.
So we're only missing one. Okay. Thank you, Gina.
Thank you, Madam President. So the balance billing protections are a consumer protection. And basically what this bill changes is that providers who work at facilities that are in network, but the providers themselves are not in network, are prohibited from balance billing consumers unless certain very narrow exceptions apply. And this, for purposes of the board, would affect APRNs, or nurses who would be working in those facilities that would be billing on their own and are not covered in a network. And in those situations, the Senate Bill 1264 requires those providers to send very specific notice to their patients or customers. The patients, customers have to elect to have the service provided, having a meaningful knowing that they could be balance billed. So it's a very narrow exception. It only applies to non-emergency services, and if the provider chooses not to seek payment for those out-of-network charges, they still can avail themselves of the dispute resolution processes that are outlined in the insurance code. They're a little different than how they used to be, which is why those provisions look a little different in the amendments that you see in your packet. They will be required to use arbitration, which is new. It used to be a mediation process at SOA, and that was changed significantly during the session. So when you look at the proposed amendments in your packet, you're going to see a lot of things struck out because those simply don't exist anymore. They're obsolete because of the bill. And what you will see are notices to providers who this may apply to about their rights, their responsibilities, and also a reference to the Department of Insurance notice that has to be used in all of these cases. That notice cannot be amended by providers. It has to be in the font that's specified by the Department of Insurance. It has to use the same words that have been adopted by the Department of Insurance. And it cannot be mixed up with a bunch of other paperwork in the hopes that a patient wouldn't see it. So it has to be a standalone document. And so those are the amendments that you're going to see in your packet. If you have any questions about that, I'm happy to answer those.
Any questions, board members? Okay, thank you. Kathy Lederhorn, can I get a motion on agenda item 7.4?
Yes, ma'am. Kathy Lederhorn. I move to approve the proposed amendments to 22 Texas Administrative Code 217.23 pertaining to balance billing dispute resolution.
Kathy, it's really hard to hear you.
Oh, sorry.
Yeah,
Is that
better.
Okay,
Yes.
so sorry. Oh. Okay, can you hear me now?
Yes. Can you
Great.
just start over so we'll make
Yes,
sure we've
ma'am.
got it?
Yes.
Thank you.
I move to, it's Kathy Lederhorn. I move to approve the proposed amendments to 22 Texas Administrative Code 217.23 pertaining to balance billing dispute resolution as set out in attachment A, with the authority for the General Counsel to make editorial changes as necessary to clarify rule and board intent and to comply with the formatting requirements of the Texas Register. If no negative comments and no requests for public hearing are received, I move to adopt the proposed amendments to 22 Texas Administrative Code 217.23 pertaining to balance billing dispute resolution as proposed.
Thank you. Ms. Scott, can you second?
This is Melissa Scott, and I second this.
Thank you. Having a motion and a second, we will now take an oral vote. Dr. Edwards?
For.
Ms. Diana Rodriguez Flores?
4.
Carol Hawkins?
4.
Kathy Lederhorn?
Kathy Lederhorn, 4.
Maisie Jamison?
4.
Tamara Rhodes?
4.
David Saucedo?
4.
Melissa Scott?
4.
Francis Stokes?
Francis Stokes, 4.
Rick Williams?
Rick Williams, 4.
Kim Wright?
Kim Wright, 4.
and Kathy Ship 4. So the motion passes. Thank you. The next item for consideration is agenda item 7.5, consideration of eliminating eligibility question on applications and petitions relating to mental health. John Vanderford will be presenting. Thank you, John.
Too quiet.
Yeah.
Is this better?
Yes.
Thank you, Madam President. Board members, the Texas Nurses Association has requested that the board reconsider its mental health question. The question appears on initial licensure forms, endorsement forms for nurses coming from out of state, as well as all renewals for nurses. TNA's request can be found on an attachment A of the board report. As you can see, the current question reads, in the last 5 years, have you been diagnosed with or treated for or hospitalized for schizophrenia or other psychotic disorders, bipolar disorder? Remember, Edwards, is there an issue?
Allison?
It's going in and out on my end.
Oh, okay.
A huge pause, and I missed a lot of the rationale.
Okay, I guess.
I cut off at Appendix A, and then.
Yeah,
Okay,
so I can take it. I can take it from right there. Board member Edwards. The current question reads: in the last 5 years, have you been diagnosed with or treated for or hospitalized for schizophrenia or other psychotic disorder, bipolar disorder, paranoid personality disorder, antisocial personality disorder, or borderline personality disorder, and which impaired or does impair your behavior, judgment, or ability to function in school or work? Now, staff agrees with TNA that this is an appropriate time to reconsider this question. Staff has followed the developments surrounding mental health questions in other jurisdictions, as well as the federal court rulings that have come down with regard to occupational licensing, professional licensing, and the Americans with Disabilities Act. Notably, attachment B, which should be attached to your board report, shows the U.S. Department of Justice's interpretation of the Americans with Disabilities Act with regard to asking applicants about mental health diagnosis. Based on this research, staff has identified potential issues with the current question, and those issues are listed in the board report, and these issues are similar to those identified by the Department of Justice in their investigation of the Louisiana Supreme Court, which licenses attorneys. And again, that can be seen in attachment B. For these reasons, staff is recommending a language change that does not single out particular mental health diagnoses, but the question still appropriately inquires into an applicant's current fitness for licensure. The new question the staff is proposing focuses exclusively on current fitness to practice, does not single out mental health diagnoses, and will not serve to deter nurses getting any treatment that they may require as a result of a fear of disciplinary action. Staff is recommending this question to replace it. Are you currently suffering from any condition for which you are not being appropriately treated that impairs your judgment or that would otherwise adversely affect your ability to practice nursing in a competent, ethical, and professional manner? And staff is happy to answer any questions about this recommendation.
Madam President, I do have a question.
Okay.
So we've had obviously an eligibility and disciplinary committee respondents that have trouble even interpreting if they have a depressive disorder or they've been an inpatient or they somehow seem to forget. And I completely understand why we should restructure the verbiage, but I'm just wondering how they're going to interpret this. And does that mean that if they're on current medication for bipolar or schizophrenia, that they can practice?
I would say that is correct. If their mental illness or mental health condition is controlled, then we would allow them to practice under the former question or the current question. I think that the most important part of the new question is including whether or not the illness is controlled in a way that would allow the nurse to practice safely.
My only concern is that they're gonna, I'm not sure they'll interpret treatment. And I don't know. I understand why we shouldn't list specific diagnosis, but gosh, I wonder if we should give examples or something because, you know, if this is for eligibility or disciplinary purposes, I can tell you, you know, pre-licensure nurses don't follow instructions, even though it's written in 4 places. So I just wonder. I'm concerned.
Yeah,
Can I
think
chime
that,
in here?
Okay.
Mr. Vanderpoort. It's
There you
David. I'm
go.
sorry, guys. I'm on the phone. Hey, so it sounds like, I mean, it sounds like our hands are tied. Would that be the appropriate interpretation for us? I mean, I know we have to vote on this, but I mean, it sounds like, you know, you're citing the Department of Justice, you know, the ADA compliance issues and all this. I mean, do we have a choice on this? I echo the concerns that have been voiced already. That is a concern for me, obviously, as we're protecting the consumers. But I mean, do we really have a choice here?
This is Dusty. Choice here. I think that what we have presented to you.
Dusty, you're cutting out. I don't know. You need it at your mouth.
Yeah.
I'm so sorry. This is Dusty Johnston. David, thanks for your question. I think that that if you looked at the board report, if you see the request of the Texas Nurses Association, what and the landscape and the what we have is a question that we are comfortable is compliant with the Americans with Disabilities Act and has, we believe, has the verbiage that's recognized as appropriate for asking eligibility, this eligibility type question on mental health. We can re-examine some of the questions that are raised here, but it is staff's recommendation that we go ahead and change this question because we're comfortable with the nature of its compliance with the law, and that we can come back and do a better sort of report to y'all if you wish on the use of these type of questions and their effectiveness and understandability. But we do know that this is the type of question that has been vetted by other occupational licensing agencies as compliant. And we're not going to say that it's not subject to various interpretations by others. And we can do a FAQ on that to help applicants understand more about the nature of this question and what we're seeking. But I hope that approach might answer some of your questions and concerns.
So Dusty, could we say it more succinctly? I had to read it twice because it says, for which you are not being appropriately treated that impairs your judgment. Could we say it a little more simplistically? Or I love the idea of the FAQ. I think that's critical for interpretation purposes, but it just sounds a little legalese, and I wonder if we could simplify it. So there's less room for interpretation. How about that?
Madam President, this is Diana, and I have a comment. I agree with changing the verbiage and everything, but I think at least where I'm stuck, and maybe Dr. Edwards as well, is that where it says which you are not being appropriately treated. I mean, who defines appropriately? So if we just said, are you currently suffering from any condition from which you are not being treated that impairs, and then it goes on, to discuss the competent, ethical, and professional manner. And so we just took out the word appropriately.
Madam President, this is Kathy Lederhorn. I also had a comment along those lines, and this board agenda item has caused me a lot of concern. Not that I don't want anybody in my backyard or anything like that. I did a lot of the research on the Louisiana court's decision. A couple of things that I had a question of were, in our previous question, we said students and we've taken them out. The other thought was right along Diana, it was who determines what appropriately is. If I take Xanax 8 times a day, I think that's appropriate. You're not going to think that's appropriate, but if you're leaving that up to me, then whatever. I've also been really concerned that, I understand that our charge is to take care of Texans, and nurses and students are Texans. And I understand the stigma, but I've truly been concerned for them. I have done a lot of research on some of these mental illnesses, and I think that I've settled in my mind that if you had an uncontrolled bipolar or those serious issues, that you wouldn't be able to work anyway, to be quite honest. If you're not seeking treatment, that you're not going to be able to have a job. But I do honestly am concerned for them, and about the appropriate treatment, and then also about adding students back in, because they've taken students out. So if I'm a student and I've got whatever, and I'm coming at this not even just from the mental health standpoint, but even the physical standpoint. I worry about some nurses, but I also kind of fell in line with Mr. Salcedo that honestly, it's like we don't have a choice. May I be so bold as to ask, has the bar changed their questions in Texas?
I'll go ahead and defer that to John if he looked at that. And let me make one statement first. Excuse me, John. The student part that you're concerned about is this particular question. The eligibility question is what we call it. The eligibility question regarding mental health, or it appears in all the forms. The application for licensure by exam, the application for licensure by endorsement, and then the renewal. So the concept of if you're going to catch the need for a student to answer this question, it's in the application process. I don't believe you have to have I don't believe the word student needs to appear specifically, because it's going to be a student who applies for initial licensure. So I think that part is
but it was there before. We've just changed it.
I don't recall
yeah, it was in there.
that particular. Yeah, it wouldn't have said student in the renewal.
Right.
Or in the endorsement question.
Turning back to the state bar question, Ms. Lederhorn asked, most of the jurisdictions of Supreme Courts or state bars that are licensing attorneys have changed to conduct only questions, where they don't ask about conditions at all. They ask if you've been fired. They ask about if you've had disciplinary issues at school. We've looked a lot at those kinds of questions, and we don't think that for nursing that they are enough. We would like to know if someone believes that they are not fit to practice nursing, and it's always going to be somewhat reliant on their answer to that question. And their appropriateness of treatment is going to come into play if we find out that something has happened, and then we'll have to look closer into how appropriate the treatment was. But I would like to return also to the Americans with Disabilities Act, and the idea basically, the overwhelming idea is that all of our questions have to be necessary to the provision of the service, and none of them can be based on any stereotypes or any idea that maybe they've been impaired in the past, so they will be impaired in the future. And I think the question that staff's recommending does address those things. It focuses only on the current impairment to practice, and it explains its necessity, because if there's a subjective view on the part of that nurse that they don't believe that they are safe to practice, then that is certainly something that we're going to want to look at. Now, as far as asking about the specific diagnoses, I think the law is clear and the trend is clear, and that is not something that we're going to be able to do anymore. The appropriateness of the treatment, I think as staff and the other lawyers can weigh in on this, we would prefer to have that in there to defend us, because just because a nurse says they were in treatment, if we later find out it's not appropriate, that's something that we can take action on. So I hope that assuages some of the concerns of the board members.
That does. I just wanted to ask one follow-up question. Maybe I'm wrong. I did not believe that when a nurse disclosed that he or she had a mental illness, whatever the diagnosis was, I wasn't aware that we kept a data bank and we watched them. It was kind of a one and done until something came up. But do we put them in some data bank in the sky and check in on them? I don't think we do. So I didn't think we were doing anything wrong.
I would like to address that as well, because as you've read in the Louisiana Supreme Court decision, many of the issues that created this sort of regulatory scheme is the processes that flowed from the answer of a positive answer to the mental health question. And that positive answer to the mental health question led to these processes that were burdensome and they were one size fits all. And I believe that Tony, Dusty, Kathy, every case that we get will be individualized. We'll get an individualized assessment. There is no one size fits all. If it does appear that someone needs a referral to TPAPN, that could happen. If it's not necessary, then the case will not go anywhere. So there is no automatic discipline for someone that answers yes to this question.
This is Tamara. I have one additional question. Is there going to be any kind of follow-up comment regarding, I guess my other concern would be that it says currently suffering. Is there going to be any additional comment that states that they must notify the board if this changes?
I don't know that we have a request that they respond again until their renewal. When they do renew, then they will receive the question again. Now, if there's conduct at work that causes them to be reported to the board, or that they're fired, then they would have a duty to report. There are some requirements that there are duties to report if a nurse doesn't believe that they're safe. I don't have those in front of me currently, but we can look into that, certainly.
Thank you.
Madam President, this is Carol Hawkins. Dusty, I know you have mentioned about the FAQ for that question. It won't specify mental health, will it? And the reason why I'm asking is you'll have nurses read into that and they can say there's physiological conditions they may have that could lead to impairment. Are you wanting the disclosure of physiological, conditions? Because it's just conditions. So it's no longer just mental health. Now, do I have to disclose you know, my diabetes because my sugar might drop. Now I'm impaired. So, you know, those, like you said, interpreting, is that FAQ gonna, you know, be specific, or it cannot say it's mental health, not physiological?
Can you hear me?
Yes.
Yes.
I'm sort of at a loss, really listening to the board members' concerns about this question. All right. We have concerns about, can someone even understand this question? We have concerns about, what does appropriate mean? We have concerns about how broad an application does this question have to people who have like a physical condition, not mental health, that could, you know, interrupt their ability to practice safely. Yes, the question was an eligibility question, you know, as lawyers, we felt would bring forward compliant with what the law was, and in response to what the Texas Nurses Association suggested that they wanted on behalf of their constituency. It's possible that we lawyers who drafted this question concerning it to be compliant with the ADA, and which it is, I'll assure you that it is, we didn't anticipate sort of this micro analysis by every applicant of what this means to me, and how do I answer this question. Didn't honestly didn't I personally didn't think of it in those terms. It seemed like I read it as a lawyer, of course, and it's a straightforward question. Am I suffering from any, you know, condition that if I leave untreated is going to affect me, my ability to practice the occupation of nursing safely? And if I have to answer that question yes, then it shifts to the board to sort of evaluate your condition, and not, you know, and not make it too burdensome for you to have a license if you don't need any kind of oversight to help you, or for the public to be protected based on what the answer was, and what we have evaluated from the information we've gathered. So I'm not sure. I feel like y'all are not sure this is appropriate question or appropriate to go forward, really. The FAQ, this was designed to be a mental health question, not a diabetes question, Hawkins. So I don't know if an FAQ can cover every potential area of understanding or misunderstanding, and I'm not sure our eligibility questions can really do that. So I think it's a good opportunity that we're talking about this, and I'd like to hear from now that this deliberation is open on this, and that there are concerns. What are some of the other ones?
This is Kathy Shipp, and so TNA's statement was, we believe a question regarding any medical condition rather than singling out mental health conditions would be less stigmatizing and discriminatory. For example, do you currently have a medical condition that impairs your ability to practice safely? So they basically took it out past, you know, mental health. I think it's hard to have one statement that one size fits all.
Well, are y'all comfortable with TNA's suggested language?
This is Kathy Lederhorn. I am not currently. And I'm probably not thinking of this appropriately either. You guys can help educate me. It's in my opinion that our hand is being forced to make this. And I'm sure. I was last aware that the ADA was made changes to in 2014, and I did not realize that the ADA specifically barred these questions from 2014. But maybe it's been updated to include that. And I understand the way
I don't think questions like this are specifically barred. I think this is an area of debate, Ms. Lederhorn. I think that this particular, we're trying to avoid controversy. We're trying to avoid we're trying to recognize the disability community's concerns that are voiced, and many occupational licensing agencies are. And this question that is presented for board review is a vetted question. You know, we've looked at it, we've studied it. Unfortunately, and I guess not really prepared, is that we didn't realize it was going to lead to a lot of confusion about how it should be read or interpreted or needs to be implemented. And that may have been, again, sort of naive on the part of we lawyers who evaluated it and drafted it. I'm kind of personally concerned about the level of misunderstanding that this particular board report and the nature of this question sort of has generated. And I'm not sure I feel like I need to hear a little bit more from the board members and maybe from some of my other lawyers here about how to proceed. I mean, one thing we can do is we can anyway. Let me hear some more concerns if y'all have any.
So Dusty, I mean, what the essence of many of the comments are that this is a little too watered down and it's easily misinterpreted. That's what I'm gathering from the collective thoughts. We're taking care of people. People's lives are in our hand. This shouldn't be a legal issue. This should be, we are here to protect the public. We are in the business of healthcare. And if you are not fit to practice, if you have a mental or physical or any condition that characterizes you in a manner where you can't take care of someone, I can tell you the current state of mental status of our students nationally are suicidal, and these are pre-licensure. They may not be fit to practice. And that is a national concern. There's much research going on in this category. You know, I think we need to screen. We can't water down this issue because we are charged with taking care of other people. If you melt down in the middle of, you know, putting an IV in, I mean, and this happens in a faculty situation all the time, how are you going to take care of someone? So you've got to be fit to practice mentally, physically, all the way around. And I just don't think you can water it down. I think there's a way to comply with ADA and not characterize it as a disability, and a way to say, are you impaired in some way from not being fit to practice and take care of someone? So I think that's where my concerns emanate from. And it's seeing the sort of, you know, repeat respondents at the Eligibility and Disciplinary Committee that you know, fall off the wagon all the time, and we try to get them the counseling and the support they need. There can't be any room for misinterpretation, and that's all I'll say.
Well, Dusty, this is Francis speaking from a consumer point of view here, and I'm listening to all this stuff, but when somebody fills out an application, and this question is on the application, how many people do you think is going to answer that thing yes? Even if they have some kind of condition. I mean, they're trying to get their license. So, I mean, if we're asking, are you schizophrenic or are you have some, and they're not going to say yes, I do, because that's going to primarily disqualify them from getting a license. At least that's what I'm thinking.
I think that Board Member Stokes brings up an important issue. The current question, of course, talks about the 5 years. Have you been diagnosed with schizophrenia or some other condition? Listing the 4 other conditions, and then asks which impaired or does impair your behavior, judgment, or ability to function in school or work. So the current question also asks, in a sense, it's up to your discretion whether or not you're going to be seen as dangerous to everyone else. So ultimately, what we have to have is a subjective question. And the Department of Justice's opinion that you cannot point out only mental health diagnoses that they believe is based on unfounded stereotypes because they could be appropriately treated, and then subject those people to further monitoring is the issue. So the current question, are you suffering from a condition that could impair you if not appropriately treated, your ability to practice nursing in a competent, ethical, and professional manner? Essentially, the difference here is that we've removed the specific mental health diagnoses, the names of those diagnoses, and the ability to practice competently, ethical, and professional is the same as the prior question that we had. And I think that's the guidance from staff, because that will bring us into compliance with the ADA, and it still appropriately inquires to someone's fitness to practice and their competence to practice. But truly, we have to ask the applicant. The prior question requires us to trust the applicant's answer. The current question requires us to trust the applicant's answer as to how safe they are. And again, the difference is the compliance with the Americans with Disabilities Act.
Thanks, John. And I think that my recommendation at this point would be for the board to take staff's recommendation, and then based on this, and approve this question, so that we can remove the previous question and have what we have advised is a more compliant question in place, and have instruct staff to come back before the board with some analysis and better recommendations, or maybe a change in recommendation with FAQs or advice or opinion that addresses some of the ideas and opinions that have been deliberated here today.
Dusty or John, could we say and be compliant? I think the part where it says, are you currently suffering? Could we say, have you ever been diagnosed with a medical or physical condition? We can't say that.
No,
we cannot say that because of the requirement that it looks only at the current impairment of the nurse. So unfortunately, we have to drop the 5-year period, and they can only focus on the current impairment.
Thank you.
Is suffering a legal term?
I don't think it's a legal term.
As someone who, the American with Disabilities Act is applicable to, the language that was read by President Kathy Shipp, where the question essentially asked, is there any medical condition that you have had in the last 5 years? I felt would be more encapsulating of mental health as well as all the other physical things that might go on. I may have not had my disabilities permanent, However, I may feel as though, okay, I need to get my license because I want to go be an educator. I'm not going to work in a hospital, so it's not applicable to me. But if you ask it in that way that President Shipp had it stated, it covers me. Then I feel compelled to say, well, yes, I do have this going on, which will open the door for further evaluation of me as well as a person that might have had something that was mentally going. So, well, yes, I did have, as opposed and still be in compliance with the ADA.
Okay.
Certainly, if you're more comfortable with that, a motion can be made. I am not. I don't. It's certainly not an objectionable question, as stated. And I think what President Shipp was stating was the verbiage specifically provided by the Texas Nurses Association in their request letter. Is that correct?
Yes, it just said medical. It just said medical condition is what I looked at, and which, since we were talking about, we were trying to take out the mental health. And
well, the previous question did. I mean, our current recommendation takes out mental health, but it does stem from the revisit of the mental health question.
Well, and it has a time frame, and we're dealing with current. Okay, so I think
President Shipp, just one more thing. I'd looked at the Texas Medical Board. As far as I can tell, they're still asking those questions. They're kind of getting some pushback now, but I don't even know where it was, but the Minnesota Physician Board, their question reads, have you within the last 5 years been advised by your treating physician that you would have a mental, physical, or emotional condition which, if untreated, would be likely to impair your ability to practice medicine with reasonable skill and safety? What do y'all think? I mean, that seems to encompass the ADA. It brings out the emotional, the physical, and the mental, which as a human, we are all that. And then to me, I would feel comfortable because it says, hey, anybody that has one of these issues and is treated, maybe not a physician, but a practitioner, instead of me saying, alcohol is my treatment. That's how I get through every day. I just wanted to, I promise I'm not being difficult. I promise I'm not. It was, like I said, I know it sounds like lip service, but I do really care for those nurses too that are suffering, and I want to help them. I don't want to throw them out, the baby with the water. But by answering that question, yes, it does open up another whole ball of wax of Tony saying, okay, we need to get a forensic eval. We need to make sure if you're good, you're good. But that was just my opinion, but whatever.
Yeah, but how many, if you were filling out that application, how would you answer that question? Are you going to sit there and say yes?
Well, Mr. Stokes, I will tell you, I would answer it. I haven't, and I would. And I think so many nurses that I've been around that are in recovery or have made mistakes but have come back, man, they wear it with honor and they are doing right and they're doing good. And they do know that we do care about them. Of course, it's the vulnerable patients, but it's for them as well.
I bet when they filled out the original application, they answered that question no.
Well, if they answer no, then the only way we get to them with getting in trouble and coming before E&D. But at least
that's exactly right. That's exactly right.
Right, but at least then we would have that to back up on to say, hey, if you're being treated and you're doing this, but
okay, I think we're to a point that we have to decide something here. And I think that I think we need to, I don't think we can wordsmith, and I don't think we can come up with an adequate change at this time, but we do want to get what is on the books off at this time. So how would you prefer that we do that, Dusty?
Well, as I stated earlier, I think that the staff's recommendation on this agenda item is really not changing. That we adopt the new question, really absorb some of the comments that were made in this deliberation, and come back with another report and potentially a better, if available, a better question or analysis for y'all to deliberate on. That's really my trusted advice right now.
And to do that, going with this question does allow us to have a better question than the one that's dealing just with the mental health until we decide to change or we decide to stay with this.
Right. That's right.
But then what happens if we pass and approve this? Does this wording go up on the website?
Yes, it changes the previous.
So why the urgency? We've been out of compliance for 4 years. Why
We're not
urgency?
out of compliance. That's not. I'm going to dispute that. We are trying to improve, and we. You don't have to change it, but we're recommending you change it.
And
so
it was requested in February from TNA. So we're in July. I guess.
Is it feasible to look at
I can't hear you.
what other states have worded,
Can you
Can't
put
hear
this
you,
to your
Liz.
mouth better?
have changed their wording to? I said, is it feasible to take a look at what other states have done?
Okay, I think that John has looked at, he looked at the cases and he's looked at some other states.
That's correct. There's a national trend of removing these mental health questions, and I mean, for instance, the Texas Medical Board no longer asks a question that references specific diagnoses or goes back in time for 5 years. Brings us into what other state agencies in Texas are doing, and then there's a number of boards of nursing, more all of the time, state or nationwide, that have been changing these questions. Last we checked, some of the applications we were able to get and some we were not, because you had to pay to receive some of them through some sort of a paywall. But I will tell you that the national trend is to eliminate these kinds of questions. And the reason is this DOJ interpretation of the ADA, which really has led to a lot of conversations about that. Both Dusty and I have spoken about this issue at regulatory conferences, and we've examined it from a lot of different angles, and we've polled other boards of nursing, and this is the national trend.
Okay. Then I need someone to make a motion. Can you raise your hand to make a motion for me if you've got the data up and you're ready, Francis? Okay.
Madam Chairman, I move to authorize staff to replace the current mental health question on all licensure forms with the following language. Are you currently suffering from any condition for which you are not being appropriately treated that impairs your judgment or that would otherwise adversely affect your ability to practice nursing in a competent, ethical, and professional manner?
Okay, and I need a second.
Madam Chair, I second the motion.
Thank you. Okay, Rick. Thank you. Okay, having a motion and a second, we will now take an oral vote. Dr. Edwards?
Or
Diana Rodriguez Flores?
4.
Carol Hawkins?
Carol Hawkins, 4.
Kathy Lederhorn,
Kathy Lederhorn, 4.
Maisie Jamison,
4.
Tamara Rhodes,
4.
David Saucedo,
4.
Melissa Scott,
4.
Francis Stokes,
4.
Rick Williams,
4.
Kim Wright,
4.
and Kathy Ship, 4. So motion carries. So we'll look forward to more information.
More
in the
on that.
future.
Thank you, board members.
Thank you, board
Thank you.
members.
Yes, and the FAQs and all that. Great. Thank you.
I'm so sorry,
what we can
President
come up
Shop. I need to step out for a minute to take care of something, so I'll come back. Is that okay?
Okay.
Okay. It won't take. Oh, yes,
well,
ma'am.
Let's see. It is a voting item. So do you guys, do you want to take a 10-minute break? Is that enough time?
Oh, yes. I'm so sorry. It was just right out my door, but yeah, that's fine.
Okay.
It's
Dan?
really close to lunch. Should we?
Yeah.
Sorry, Madam
Lunch?
Madam
Are we
President, it's
breaking
really
for
close
lunch?
to-
Okay.
Oh, it's fine, y'all. It's not that big of a deal, I promise.
Well, we need to decide anyway. We've got this other things to go. So yes, it's 12 o'clock. So let's just go ahead and take, I was trying to keep us on 30 minutes. Are y'all good with that? Can you shake your heads? It's 30 minutes enough?
Sure.
Okay. Right now I have
Sure.
12:06, and so we'll come back at 12:35. Good? Okay. Thank you.
Thank you.
Okay. Okay. Hello, everyone. It is 12:43, and we are resuming the July 23rd, 2020 Texas Board of Nursing meeting. At this time, the next item for consideration is Agenda Item 7.6, consideration of proposed legislative appropriations request, LAR, exceptional items for fiscal year 2022 to 2023. Mark Mayak will be presenting. Thank you, Mark.
President Shipp and board members. On agenda item 7.6, what you see is the request for the LAR. Most of you remember that we made this presentation officially to the board back in January. Most likely you can see that there's been some changes. Along with those changes obviously came with the emergency that we're under, and the state revenue has dropped, as you well know. We just received that information this past Monday. Also, the board was ordered to cut their budget, our budget, by 5% in this biennium. So all this has a play, the environmental issues have a play in this request. So what you see is a pared down request about what we're looking for, back to the real basics of what we can look at to continue the agency to run that we think efficiently and effectively. So before you in the budget, we looked at the priorities. There are, I believe before you, 4 priorities that we're looking at this time. And one will be driven by the moving costs. And unfortunately, we're still visiting with the Texas Facilities Commission and Department of Information Resources, who has the information to get back to us. So what I can tell you as far as the move to the new building, that is still on time for July or the summer of 2022. So we're still in that phase of moving forward. We just discussed this last week with the Facilities Commission. They're still moving forward. There are discussions with DIR. So last week they told us they will still be reaching out to the board to talk about specific costs, especially the telecom costs, hooking up all the rooms for the phones, the special phones. We wanted to hook up the conference rooms internally with large screens so we could have meetings just like this and as groups. So we'll be updating that information as soon as we can. Given the situation now at this point, we still don't know at this point what's happening to the hobby building. We know that obviously they're going to want to sell it. But the discussion now that we're having is whether we should be taking our furniture or not taking our furniture. At first, they were saying most likely leave it here because they can sell the whole building and they can sell what's in it. But given cost-cutting measures and having to buy new furniture, that might not be feasible. But we just want to let you know that this is on the table, that we'll be either looking at purchasing new furniture as in volume with all the other agencies, so we'll get the economic impact on that, or we might have to move most of our furniture. And given that fact also, we'll have less offices in this new space. There'll be more cubicles, so there'll be less offices. So we do have enough furniture, but to move furniture is costly, as you well know. But that's on the table. So I want to let you know that the reason why there's no cost to this is that we don't have the cost yet from the Facilities Commission or the Department of Information Resources. Once we have that, it will be plugged in. The second one is looking at our information technology. We are looking at our information technology infrastructure at this point. In hindsight, I wish we'd had this a long time ago, but we've learned a lot. But in this particular case, we're going to focus on the move and where we're moving everything we can to the cloud. In fact, the Facilities Commission in their meetings about moving to the new building, they were very clear about moving everything you can to the cloud, and please do not bring your servers, leave everything, get rid of them, put everything to the cloud. They were very clear about that. So we think we'll have a lot of support for this. But right now, like our email is not, it's internal, not external, it's not in the cloud. We will still have, even though we've moved to ORBS, which ORBS, the licensing system, is in the cloud with the National Council, and eventually our enforcement will be in the cloud also. Then there will be still items here at the agency we still will have to put in the cloud. So there will be some ongoing cost, monthly cost to put information into the cloud. Plus, we want to be really as technology savvy as we can. We want to make sure that the new office space has all the latest technology. you know, and visiting some of our other sister agencies and going to the National Council, seeing all the things that we can possibly do, make it a little bit easier for staff to talk to not only you, but our constituents from our new facility would be great. But we've got to buy some new screens, new laptops. We need scanners because we want to make sure everything's paperless. So any paper that we do get, we want to scan it according to our records retention policy. We want to have a robust webinar platform. We want to be able to live stream eventually. We want to look at having our own Laserfish system. And the reason I want to say that is that we share a Laserfish system with other agencies. There's economy of scale there, but the bottom line is we need to have one with ORBS to make sure it goes in there, because I can tell you when we launched ORBS, the Laserfish system went down. We had to delay it somewhat. So we need to control that. So we're looking at buying Laserfish to ourselves. And then moving our email system to Office 365. Most of you probably have heard of Office 365. We would like to do that, but we need this ongoing cost to back that up. So we're looking at our information technology infrastructure and moving whatever we can to the cloud and buying the hardware and software we need for the new space, which will be in the next biennium. We also are looking at having a retirement contingency rider. And in that, we had a discussion in the past about this, and that was many of the agencies that have long-serving staff. And the law says in our particular area in the state of Texas, it says we have to pay out annual leave or vacation leave when somebody retires or when they leave. We've always had to do that. But we've never had the number we have in this office now that have potential retirement. There's 4 people in the office that have high annual leave. And if we had to pay it out, it would cost us around $145,000. And that would be a huge hit all at one time. So this is a contingency rider. And the contingency would be is if any of these 4 people left the office and retired or left, and we had to pay it out, that we would get the money in that case. They would appropriate the money to us, and that we wouldn't have to ask for it again. It wouldn't have to come out of any other budget. So I know this is the first time you've seen something like this, but if not, we have 4 people that have 30 or more years with the agency. So that's pretty big, and it's a huge hit, and we don't want to take it out of other budgets. So we'll be asking for a contingency revenue rider, and many other agencies have done this, so this is not new to the state, so we're going to be asking that we do that. And the last is the executive director salary. We have been very fortunate that the last biennium, when the board made the recommendation that they wanted to ask for the full range, salary range, or whatever the economic study was from the state auditor's office for our executive director, they gave us at 100%. We were very fortunate. That was excellent. And we would like to continue that. I'm assuming that the board would like to continue that. So what will happen is most likely this summer, there will be a study by the compensation study for executives for the state of Texas that will come out, and we'll be able to plug that in there. But what I'm asking you to look at is maintain your policy that you would ask for whatever that executive salary compensation the cap is, and we'll be asking for that. So the cap would be whatever the state auditor come at. We will ask for the full amount, whatever that increase might be. We are very fortunate in many ways, and that is our revenue is still coming in. It hasn't slowed. In fact, it's increased more than we had thought. We've always been very conservative in our revenue estimates, and why this is important is the fact that we can estimate now, given what I know with the trends of LVNs, RNs, and APRNs. The biggest growth is RNs and APRNs. Given what I see now, between this year and next year, before we even go into the session, we'll have about an extra $1 million. When I say that, is that every 2 years when the state legislature gives us an appropriation, they tell us how much money we have to raise to cover all our costs. And all our costs meaning whatever they appropriate to us and all the overheads, our retirement, the cost of this building, they put it all in one lump sum and we have to pay for it. But it's in one group, it's one amount of money, sum of money. And we do that. So that's the amount of money that you tell me, Mark, we want to make sure we have enough revenue coming in to do that. And that's why we come to you asking you about the fee structure. So the fee structure is what you look at saying, and I make that recommendation and we move forward. We've been fortunate on the growth for RNs and APRNs, and I estimate we'll have an extra $1 million. The downside of all that is that we can't spend that extra $1 million. We can't. It's going to be swept away. We cannot use it. We just can't. That's the law. The beauty of that is, looking at the next session, I would doubt that looking at these 4 areas that it would go over $1 million. I would be greatly surprised. I don't think it will be, but we won't know that at this point. But that will be the strategy that we'll be looking at, that even if they granted all this, the funding for the move, for the infrastructure, for anything that we're asking for, we would not have to raise fees at all. And I'm not even taking into consideration, we're talking about 22 and 23. We're going to have exponential growth in 22 and 23. And I'm not even taking that into consideration right now. We're only looking at what I know now is I can see the trends at about $1 million we'll have extra that we will have, that we'll continue to get in 22 and 23, and probably another $500,000. Usually that's our growth. So we can't count on it, but that looks like what's going to happen. But if you think about now, and we're in a difficult situation, and our revenue is still growing, I think that trend will continue because they're always going to need nurses. So that's good from that perspective. So from a revenue perspective, we can cover all this, what we're looking for. And so what we're asking you is to approve this budget. When I look at this LAR, is to approve it the way it is. So you'll be telling us is if you approve it, that we will be asking for the same amount of money that we have now. That's the same amount of money. So whatever we have in 2021, we'll be asking for that as our base budget, and then the increase in these 4 items. And of course, the only one I can give you right now is the information technology, but I really doubt that it's going to be more than $1 million. So we won't know that for a while until we get the cost from TFC, Texas Facilities Commission. So what we're asking for you is to look at this and make this recommendation. The caveat being at this point is that we still don't have the instructions for the LAR, the Legislative Appropriations Request. That's atypical, but everything's everything's atypical at this point. Usually we've had to file our LAR by this time. So we're coming back to you because there's changes. We don't have the instructions. We're making some assumptions that those instructions will be very clear about cuts that we'll have to look at. But what we know now, we think this is a bare bones. This is it's business based. It's backing the infrastructure that we need to do business on a daily basis. And we think this is the best for the Board of Nursing, and it will allow us not to increase fees in the future. So we think this is a good plan to look at now, and if y'all approve it, and we'll use this as our plan moving forward when we do get the instructions to the LAR. Any questions?
Any questions, board members? So I'm just clarifying. So so you said we're going to have the same as we had for 2021, for 22, 23, and what we're asking for in those items, we will absorb with those increases.
Correct. So every 2 years when we look at this, the legislature usually asks, do you want your base budget now? And we're saying, yes, we would still like our base budget the way we have it now. So we're assuming that. So that's going to still take care of the normal operations that we have, the 125 FTEs, all the payments that we make now, that was taking that into consideration. But if we get these 4 extra items, then obviously it'll have to be beyond what our base budget is now. So what staff is recommending to you is that you allow us to say, we still want our base budget to fund the 125.7 FTEs and infrastructure that we have now. We want that to continue, plus the 4 items that we're asking the LAR, the exceptional items in the LAR.
And so this takes into consideration that 5% cut that the governor asked for?
The 5% cut actually is being charged to us now. So by the end of this fiscal year and next fiscal year, we had to put a plan in to say this is how much, where we're going to put the money, where the money is going to come from to go back. We're asking for that money back in the base budget. We're making an assumption. We're not going to ask that be reduced. We're saying we still want what we originally were given a year ago. We still want that base budget plus our $750,000 that we're having to give back this year. We want that as our base budget.
Okay. Thank you. Any other questions, board members? Okay. So I need a motion on 7.6. And Francis, would you like to make that motion for me, please?
Yes, ma'am. I'd like to move to accept the staff recommendations for the list of LAR prioritized exceptional items for the 2022 and 2023 legislative appropriations requests, which include the current 2020 and 2021 base funding.
This is Diana, I second.
Oh, great. So I have a motion and a second, and now we will do an oral vote. Dr. Edwards?
For.
Diana Flores?
4.
Carol Hawkins?
Carol Hawkins, 4.
Kathy Lederhorn? Oh, can't hear you. Kathy?
Sorry. Kathy Lederhorn, 4.
Maisie Jameson? I can't hear you. Can you unmute? 4. Got it. Tamara Rhodes?
4.
David Saucedo?
4.
And Mr. Saucedo is in by phone. He's having weather issues in El Paso. Melissa Scott?
4.
Francis Stokes?
4.
Rick Williams?
4.
Kim Wright?
4.
And Kathy Ship, 4. So motion passes. Thank you. The next item for consideration is agenda item 7.7, update and report on the optimal regulatory board system ORBS implementation. Mark Mike will be presenting. Mark?
Good afternoon, President Ship and board members. This is an oral discussion about the implementation of ORBS. And I don't want to make any assumptions here in that ORBS is the name from the National Council gave it. It's the Optimal Regulatory Board System. And it was a licensing platform created just for state boards of nursing from our National Council. Already 9 states have implemented this ORBS process, their platforms. And so we had some background in that information. So we've been looking at how it's been developed. And then they started developing it with us, the board, last year. We call it the Texas Nurse Portal. So that's what you will always see when you go to our website, is called the Texas Nurse Portal. This has been over a year in the making. Really, it's been 3 to 4 years. I still remember Kathy Thomas and I cornering Nur Rajwani and the National Council saying we wanted to be first. And that was 3 to 4 years ago. And look where we are now. It's 2020. So when we look at that, it's been going on for a long time. So we've had a lot of feedback looking at how the other states using the system and as it has changed over a period of time. We spent over the last year, wanted to let you know the biggest item was the migration of data. Texas is the biggest board that they had. So we had over 1 million records, if you can think about that, had to be translated into the new system. So the migration of data was huge from our part. So we had staff doing that, looking at testing, putting it in user acceptance testing scenarios, migrating the data once a week, seeing what it looked like, staff providing feedback. So the data was real important. So we spent a lot of time on data migration. Then we started on user testing, which we mostly did from inside. Keep in mind, this is pre-COVID. So we would have training sessions in the conference room. We'd bring people in, we would talk about it. National Council had 3 or 4 business analysts. They came in to the office and did one-on-ones, and we went round and round and round about how to make things better and make it a Texas Nurse Portal. Then we had continued staff training. That continued until at least COVID hit. Then several things had to happen, and that was we were initially supposed to start February of this year. We moved it to April because we were not ready. So we negotiated with the council to move it to April 15th. Then as COVID hit and the emergencies came on, we knew that we could not start on April 15th. So we again negotiated with the National Council. And the reason I say that it's important is that, remember, council puts all their resources into this. They have business partners, they have all these people. It's not really easy for them to say, let's put this off. It costs resources on their side. So we were very thankful to the council for what they did, because they had to put a lot of stuff off and extend contracts for the Texas Board of Nursing. We made an agreement and we said we will launch on June 15th. What we started doing at that point, starting reaching out, doing outreach. We did it to nursing organizations, legislative oversight agencies. We even sent emails to legislators, because we know when people are mad and can't get, we knew the system was going to go down. All these things we were preparing for. We notified the legislators and all the oversights, the governor's office, LBB, lieutenant governor's office, the House Speaker, all of them got notified about this was about to happen. Other state boards of nursing, and then of course in our newsletter. And one of the reasons why we weren't as aggressive in looking at giving out this information is because we were the largest board. When you're talking about 450,000 licensees, council was worried that it would be swamping the system and it would overload the system and shut it down. So we agreed that we would do it obviously upon renewal. Made perfect sense. So we started looking at how we would do it upon renewal, of course, the new licensees. So there was a purpose behind why we advertised the way we did. We just didn't want to tell everybody go on June 15th, the system would have shut down. So we were purposeful in what we did. So what we did then, looked at paper applications ceased on May 29th. We processed everything we could after the fact, because we disconnected Texas Online on June 5th. And then after that, the data migration occurred within a week. We launched ORBS on June 15th. And I will tell you, many sleepless nights before that, all of us holding our breath. Keep in mind, all during this period of time when COVID hit, then obviously council couldn't come in. So we had to strategize on how we had, I call them war rooms, basically in Chicago and in Austin. We had them on the screen just like you all the time, listening and talking, because obviously we usually had council is there when a state launches, so they could say they can fix problems immediately and be over shoulders to watch as staff work the system. Obviously, we couldn't do that. So we really had to re-strategize. And in the long run, it was good because council has learned how they can maybe save a lot of resources in the future with future boards, because sometimes they don't need to be here. So we learned a lot. The biggest challenge, again, was staff not being in the office and lack of training, hands-on training. So we lost a lot of time in that particular area. But so that on the morning of June 15th, I told you the Laserfish system at 8 o'clock had gone down. And the reason Laserfish was so important because that's where the data flows, the history flows. So of course, stress went very high that morning until about 8:35 that morning when somebody on the national in Chicago said, we have our first renewal. And then there was a sigh of relief. And then it started. But it was huge from that perspective. And the launch started at that point. I can tell you as for 1 month already, at this point, we have created, for only in 1 month, 42,677 accounts have been created. 36,500 applications have been initiated. Of course, now online renewals are automatic, automatic, and they can see it immediately at that point. So we're looking at our stats as we go through this process that we've started. We've got some trends. We've been providing a lot of feedback to council, and they've been very, very receptive at council. We are very fortunate that council's doing this for us, because remember, that's at no cost at that point. So they have the resources in Chicago that are helping us now. The challenges that we faced was the remote oversight was difficult. So we had meetings, we talked a lot, and then when remote training, we had remote training, but still some things are for example, myself, trying to learn how to process an application in ORBS is very different than paper, because remember, we have paper to paperless. We also, at that point, when we tried to connect our nursing jurisprudence exam and our criminal background checks, there was a disconnect on our side in trying to connect it with ORBS and then send it to our third parties. We have worked it out. We're almost there. We've almost got it done. But you can imagine at that point when somebody created an application and then couldn't do the jurisprudence exam or couldn't get their criminal background check, what did they do? They called, rightfully so, or sent an email, or you might have got a call. So that's what happens. We're pretty close to almost finishing that off. The other piece is that keep in mind, we had the old system and the new system. So we had to migrate all that data and all the applications. So all the exam applications, endorsement, APR, and anything that was created in the old system that had not been finished was migrated to the new system. The downside of that is that in that migration, of course, some of the information didn't translate correctly. We knew that was going to happen. We visited with the Arizona Board of Nursing and the Louisiana RN Board. They gave us a lot of feedback. We knew what was going to happen. We were fortunate that our data was cleaner. Most of the app information was good. So we were able to stave off some of that information. So that helped out immensely. But from that perspective, trying to communicate that back and forth was difficult. So the challenges that we have now, for example, is those exam applicants that applied prior to June 5th, we have to look up their new system and deem them eligible, again, still by hand. That will eventually go away. The same with those who took the exam, the NCLEX exam. If you've filed your application prior to June 5th, and post June 15th, what we have to do is we get the results. My staff and applicant by applicant, we have to review that information, say that they're okay to go, and issue the license. Probably another month or so, that will be finished. Anybody who's created an application in the new system, it will all be automatic, and you won't need any hands-on. So we're looking forward to that. I can promise you at that point. That's probably why you get calls saying, I need my license. You're hearing that, and that's the reason why we're doing it applicant by applicant. We should be finished sometime early next month and catching up. And that's another reason why we moved to saying we need up to 15 working days. So you probably saw that on our website. So you still get calls on that, and that's probably what happened. The other thing, obviously, the testing sites went down. Pearson VUE went down. Of course, they called us. They're going to call us, which is obvious. We're so fortunate that council got the sites going back up faster than normal. That helped us out immensely. So that's good. The schools of nursing were outstanding in communicating and working with us, not only with their students, but trying to get the exam. And we would give them information. They would give it out to the students. So kudos to our schools of nursing. We're so pleased with how we partnered with them in this particular area. We knew the phone calls would increase. They have. We have about 20 in the queue most of the time. And we're hoping that once we get past this manual phase, that this will drop and we'll be able to answer all their questions. The next steps that will happen is that upgrades will continue. We have already an upgrade that will start tomorrow that will help us out in many ways. There will be some huge upgrades next year that we kept saying, we want this. In the perfect world, we want this. Well, we had a parking lot issues, and they're going to be upgrades sometime early spring next year. So we'll see upgrades to the current system that will help all our constituents. And also from this point on, we're working with our enforcement team. We will be moving our enforcement module to ORBS. It's not on there yet. Now we do have to take the complaints online, which we do. And then eventually enforcement has to get the final disposition into ORBS. So we'll do that. But outside of that, the enforcement piece is still in the office. And that will be next September, we'll be launching that. And then in the meantime, we'll be continuing all our connections that we have to our third parties, which there's 5 or 6. We'll continue to make sure that those run smoothly, and that will be helpful. But for right now, we still have some tweaking to do, and it's working well. There's been some hiccups. What I can say is at least the system did not break, which was council was afraid of, and we're doing tweaks, and the tweaks will help us out, and they're going well. I will tell you this was definitely an agency-wide grouping that had to happen. It had to happen to support agency-wide, the nursing staff, the enforcement staff, the legal staff. Everybody had their hands on this because we had a lot of questions, and everybody came to help us and launching that time, because especially APRNs, the schools of nursing, the legal questions we got, the enforcement questions we got, but it was truly an agency-wide effort. And I'm so thankful to that, and we appreciate your support that we got during this period of time. Any questions?
So just a comment. So I was one of those to do my license that first morning. And so I told Mark I'd be the guinea pig and go in and do it. And so it was a little interesting because you have to go in and put yourself in nurse sys, and you have to even know dates of when you finished your education and all, and then go back into our nurse portal and all. And so it's just it went okay. It was just interesting. And I sat down like at about 8:30. I was like, well, I'm going to get this out of the way. I told Mark I would. I'd get it done early this morning. A couple of hours later, partially my problem and the fact like, what the heck? When did I graduate from BSN, MSN, nurse practitioner, and all of those kinds of things? But it's really nice because it's going to be wonderful, but it really is more data. And it's just more to be able to allow us to collect about our group. And I just see it being really good from here on out. But, you know, in the past, it was shorter than that. And it just, I didn't have any problems once I kind of got my act together and realized, oh, I need a little more information than what's just in my head to be able to do it. So I don't know if, is anybody else gone in and done it? Not yet? Oh, Kathy, you have to?
And President Shipp, what I can tell you is from the phone calls, because we're monitoring the issues that go through the phones with the customer service team, and seldom is it about how ORBS works. So the videos helped. So seldom do we ever get that question. Well, that's wonderful because it's pretty intuitive from that perspective. Obviously, the things that I want my license, I can't do this, that type of scenario has been the biggest question, but how it works has been intuitive and worked very well.
Yes, and I just followed the instruction. I mean, you know, it was the video. You have to go in and do it, but you're not going to have to do it every time. So Kathy Thomas, how did it go for you?
Well, I only created my nurse portal. I wasn't due to renew yet. I will renew in September.
That would probably be a good thing to do. Yes, to go in and already be in there, but I hadn't had a need for that.
You
so
can
thank you,
create
Mark.
that.
President Shipp, so I guess we should all go in and create it prior to the time our license coming due. I didn't think about that either.
Yeah, don't do it on the last day of your birthday month and go, oh my gosh, where is my resume and my information and all. So yeah, you need a little bit more time. So and that way you've got it. Just for this year, I would just kind of pass that on to everybody that you know. That's like when you renew, you need a little more time. But it, you know, it worked. So, and thank you, Mark. We appreciate so much. We know that this has been monumental, and staff, all that you've done. We really appreciate that. And I could just see the whole time I was doing it, I was like, this is going to be so good to have all of this. You know, this ease of records, and it also the nurse sys part of being able to check other license and all. You know, National Council is a good support for all of us.
President Shipp, I'd be remiss to thank especially one person, that's Dan Fletcher, who's, we couldn't have done it without him. He was absolutely amazing. And I think you have to have that personality too, to be able to take a lot of heat, a lot of criticism, a lot of going back and forth. Because remember, we were going between National Council, our staff saying, no, 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 I want this. And them saying, no, 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 you can't have it. And then Dan's in the middle of it. And Dan has that personality. He just smiles and absorbs it and says, this is what we can do. We could not have done it without Dan Fletcher. I just want you to know that. And I so thank him for what he did for us.
Well, we can see what a worker he is because he helped us with this virtual meeting today. So we appreciate that and are glad to have him on our team. Any other questions, members, or statements? Okay, the next order of business is the open forum. So it is 1:17, and I'm going to read our script. Good afternoon, ladies and gentlemen. On behalf of the board, I'm recognizing this time as the beginning of open forum. Normally, this is an opportunity for the public to voice observations and opinions about the regulation of nursing, the approval of nursing schools, and our nursing practice issues, which fall under the purview of this agency. We welcome ideas or recommendations about issues in nursing practice or education. The information shared with us will assist the board in its regulatory role. The mission of the Texas Board of Nursing is to protect and promote the welfare of the people of Texas by ensuring that each person holding a license as a nurse in the state of Texas is competent to practice safely. Keep in mind the board's jurisdiction is limited to the approval of schools of nursing, examination and licensure of nurses entering practice, and the regulation of nursing practice or practicing nurses. Many aspects of healthcare, such as the operation of hospitals and the licensure or practice of healthcare providers other than nurses, are beyond this board's purview. In eligibility and disciplinary matters, the law provides that the board act on the basis of admissible evidence, which is secured and presented within the requirements of due process and the Administrative Procedures Act, the APA. Therefore, during this forum, we cannot receive information about any pending cases. We would normally invite those wanting to address the board to identify themselves and present information to share with the board. Members of the public were provided prior notice, both on file with the Secretary of State's office and on the board's website, of the opportunity to request to present verbal or written testimony related to this hearing. Board staff has received no such requests. So having no requests to present any testimony, I'm now closing the open forum, and this time is 1:20. Thank you. Next, we will consider items under 8.6, ALJ proposals for decision, agenda items 8.61, consideration of proposal for decision, recommendations, proposed settlement agreements, if any, and board action in the matter of permanent certificate number 308776, issued to Carlos Rashawn Davis, SOA docket number 507-195409. Gina Abel will present the agenda item. Ms. Abel?
Thank you, Madam President, board members.
Thank you.
This agenda item is related to a hearing, and a proposal for decision was issued by the administrative law judge. Following the hearing, the administrative law judge found that the respondent violated the Nursing Practice Act and board rules by taking a patient's cell phone, scrolling through it, and refusing to leave the room when the patient took a call from the facility's administrator and then asked the respondent to give him some privacy, which the respondent would not do. The respondent was represented during the hearing by an attorney, and following the issuance of the proposal for decision, counsel did withdraw representation. You have in your board packets the proposal for decision and staff's recommendation, which is the same as the ALJ's recommended sanction, which is a warning with stipulations for 1 year to include remedial education coursework, for there to be indirect supervision, employer notifications, and then the quarterly employer reports that allow the board to monitor the completion of the order during that 1 year time period. And I'm happy to answer any questions you might have. The proposed order is in your board materials.
Any questions for Ms. Abel? Board members? Okay. Tamara, could I have a motion, please?
Yes, I move to adopt all the proposed findings of fact and conclusions of law in the PFD and impose a warning with stipulations against the respondent's license as is set out in the proposed order.
And Ms. Scott, could you give me a second?
This is Melissa Scott, and I second that.
Thank you. Having a motion and a second, we'll now take an oral vote. Dr. Edwards?
4.
Diana Rodriguez Flores?
4.
Carol Hawkins?
This is Carol Hawkins, 4.
Kathy Lederhorn?
Kathy Lederhorn, 4.
Maisie Jamison?
Jameson, 4.
Tamara Rhodes?
4.
David Saucedo?
4.
Melissa Scott?
4.
Francis Stokes?
4.
Rick Williams? Rick, I can't hear it.
4.
Thank you. Kim Wright?
4.
And Kathy Ship, 4. Motion passes. Thank you. Next, we will consider agenda item 8.6.2, consideration of proposal for decision, recommendations, proposed settlement agreements, if any, and board action in the matter of permanent certificate number 330947 issued to Jose Orlando Diaz, SOA docket number 507193433. Ms. Abel will present the agenda item. Ms. Abel?
Thank you, Madam President. Board members, this was another hearing that was held at the State Office of Administrative Hearings. Following the conclusion of that hearing, the administrative law judge found that the respondent was working as a home health nurse, and during that time violated the nurse-patient relationship by several things, including giving the patient's sister a note with a heart and a phone number on it. The administrative law judge found that the respondent's conduct was not isolated or minor, that there were a series of incidents that caused distress to the sister of the patient. And even though the actions were aimed at the sister of the patient, the contact was made possible by the nurse-client relationship between the respondent and the patient. And because of that, the administrative law judge found that the respondent abused his role as a caregiver to the patient, and made a recommendation for a 2-year probated suspension to include several stipulations that are listed in your report. Staff is recommending the same sanction, a 2-year probated suspension, to include several remedial education courses, employer notifications, direct supervised practice for the first year of the order, to be followed by indirect practice for the second year of the order, quarterly reports, therapy reports, and a restriction to adult patients only, which is something that was specifically recommended by the administrative law judge and the PFD. And that order is in your board packet for your consideration, and I'm happy to answer any questions that you might have.
Members, any questions? If there's no questions, Kim Wright, can you give me a motion?
Yes, Madam President. I move to adopt all the proposed findings of fact and conclusion of law in the PDF and impose a 2-year probated suspension against the respondent's license as it is set out in proposed order.
Okay, and it's a PFD.
What did I say? I'm sorry, PFD.
We use PDFs a lot. Okay.
Oh, so I'm sorry.
Great. So we have that motion, and Francis, can you give me a second?
Yes, ma'am, I second.
Thank you. Having a motion and a second, we will now take an oral vote. Dr. Edwards?
4.
Diana Flores?
4.
Carol Hawkins?
Carol Hawkins, 4.
Kathy Lederhorn?
Kathy Lederhorn, 4.
Maisie Jamison?
Maisie Jamison, 4.
Tamara Rhodes,
4.
David Saucedo,
4.
Melissa Scott,
4.
Francis Stokes,
4.
Rick Williams,
4.
Kim Wright,
4.
and myself, Kathy Ship, 4. The motion passes. Next, we will consider agenda item 8.6.3, consideration of proposal for decision, recommendations, proposed settlement agreements, if any, and board action in the matter of permanent certificate number 642611 and 119548 issued to Jamie Magorga Dixon, SOA docket number 507-200395. Gina Abel will present the agenda item. Ms. Abel?
Thank you, Madam President, board members. This was another case that was tried at the State Office of Administrative Hearings. The respondent was represented by counsel. And following the hearing, the administrative law judge found a violation of the Nursing Practice Act and board rules, specifically that the respondent failed to document her collaboration with her delegating physician when she prescribed Vyvanse to a 5-year-old patient, and that she ordered the drug for an off-label use without having evidence-based research to support that use. And while she did discuss that issue with her delegating physician, the physician did not order the drug. The respondent was the one that did, which is a violation of board rules. As a result, the administrative law judge recommended a remedial education order with a fine of $500 to include several remedial education courses. Staff recommends the same order, remedial education with a fine of $500 to include courses in jurisprudence and ethics, critical thinking, documentation, and a PRN scope of practice. And I'm happy to answer any questions if you have any.
Thank you. Any questions, board members? Okay, if I could have a motion, Ms. Flores, please.
Yes, Madam President, I move to adopt all of the proposed findings of fact and conclusions of law in the PFD and impose a remedial education order with a fine against the respondent's license as it is set out in the proposed order.
Thank you. And Tamara, can you give me a second?
I second.
Thank you. Having a motion and a second, we will now take oral vote. Dr. Edwards?
4.
Diana Rodriguez Flores?
4.
Carol Hawkins?
Carol Hawkins, 4.
Kathy Lederhorn?
Kathy Lederhorn, 4.
Maisie Jamison?
Maisie Jamison, 4.
Tamara Rhodes?
4.
David Saucedo?
4.
Melissa Scott?
4.
Francis Stokes?
4.
Rick Williams?
4.
Kim Wright?
4.
And Kathy Ship, 4, and the motion passes. Next, we'll consider agenda item 8.6.4, consideration of proposal for decision, recommendations, proposed settlement agreements, if any, and board action in the matter of permanent certificate 728838 issued to Kahaja Muhammad Fawaz. SOA docket number 507-200439. Gina Abel will present this agenda item. Ms. Abel?
Thank you, Madam President, board members. This was another hearing at the State Office of Administrative Hearings. The respondent was represented by counsel during the hearing. Following the issuance of the proposal for decision, counsel did withdraw. Following the hearing, the administrative law judge found that the respondent did violate the Nursing Practice Act and board rules by sleeping on duty while caring for a home health patient. The administrative law judge found that this was a potentially aggravating issue because the respondent does not hear well and she did not use her hearing aids. And as a result, it made it potentially where she could not hear the alarm from the patient's ventilator while she was sleeping. And that was a significant aggravating factor that was found. Additionally, the ALJ notes that the respondent has already been sanctioned by the board prior to this in a home health setting. As a result of that, the administrative law judge found that a reprimand with stipulations would be appropriate as there was no mitigating factors found, and that should include a remedial education course and other stipulations that the board sees fit. As a result, staff is recommending a reprimand with stipulations for 2 years to include a nursing jurisprudence and ethics course and a critical thinking course, employer notifications, direct supervision for the first year of the order to be followed by indirect supervision for the second year of the order, and quarterly employer reports. These stipulations are consistent with board precedent and board rule regarding a reprimand with stipulations. There's also respondent submission, which is included in your board packet, along with the proposed attached order. And I'm happy to answer any questions that you might have.
Any questions, board members? Okay, Dr. Edwards, can I get a motion on this agenda item 8.6.4?
Yes. One moment. I move to adopt all the proposed findings of fact and conclusions of the law and the PFD and impose a reprimand with stipulations against the respondent's license as is set out in the proposed order.
Thank you. And Mr. Stokes, could I have a second?
Yes, ma'am, I second.
Thank you. Having a motion and a second, we will now take an oral vote. Dr. Edwards?
Four.
Diana Rodriguez Flores?
4.
Carol Hawkins?
Carol Hawkins, 4.
Kathy Lederhorn?
Kathy Lederhorn, 4.
Maisie Jamison?
Maisie Jamison, 4.
Tamara Rhodes?
4.
David Saucedo?
4.
Melissa Scott?
4.
Francis Stokes?
4.
Rick Williams?
4.
Kim Wright?
4.
And Kathy Ship, myself, 4, and the motion passes. So there's a little bit of delay when I'm asking and even when you've put on, so there seems to be like a waiting time, but it doesn't, I see you moving like you're saying it, but it doesn't come through to us. So, okay, next we will consider agenda item 8.6.5, consideration of proposal for decision, recommendations, proposed settlement agreements, if any, and board.
President Ship, your statement earlier, were you were able to hear the eventually the board members vote?
Yes, if I can't hear it, I clarify. But there is a lag for many of them, not all of them. So I was just telling them when I'm waiting when I've seen their mouth move, but I haven't heard anything. I wait to hear it.
Right, and you heard it. You heard everyone.
I heard everyone. Yes. Okay, in the matter of permanent certificate number 337398 issued to Leslie Hernandez, SOA docket number 507-202877. Ms. Abel will present this agenda item. Thank you.
Thank you, Madam President. Board members, this case was handled through a motion for summary disposition, and a proposal for decision was issued on that. And this involves the respondent's criminal history. In November 20th of 2019, the respondent pled nolo contendere to the third-degree felony offense of injury to elderly, for which she received 2 years deferred adjudication community supervision. Injury to elderly is one of the specified offenses in the Nursing Practice Act. That's Occupations Code Section 301.4535. And that section requires the board to revoke a nurse's license when they have either pled nolo, guilty, or been found guilty of the offense of injury to elderly. And so the ALJ recommended revocation as mandated by that statute. That is also what staff is recommending. There's one typographical error in the license number and finding of fact number 1, which is why staff is not recommending that you adopt that finding of fact. But the rest of the findings and conclusions, staff is recommending that you adopt, and also adopt the sanction of revocation. And I'm happy to answer any questions you might have.
Any questions, board members? Okay, seeing none, Rick, could you give me a motion, please, on agenda item 8.6?
Yes, Madam Chair.
Yes. Okay, 0.5. Yes, sorry. Thank you.
Madam Chair, I move to adopt all the proposed findings of fact and conclusions of law in the PFD, except for proposed finding of fact number 1, and revoke the respondent's license as set out in the attached proposed order.
Thank you. So, and Maisie, can you give me a second for that motion?
I second. This is Maisie Jamison.
Thank you. Having a motion and a second, we'll now take an oral vote. Dr. Edwards?
For.
Diana Rodriguez Flores?
For.
Carol Hawkins?
Carol Hawkins, for.
Kathy Lederhorn?
Madam President, can you call her again?
Okay, Kathy Lederhorn. She just went off. She was having trouble. You can't mute with your headset. You have to mute with on your computer. Can you unmute her, Patricia? No.
No, that's why we don't want them to use the mute on the headset. It essentially causes a lock.
No idea. Did I touch it? I'm sorry.
Okay. Okay, so can you give me a vote? Kathy Lederhorn.
Yes, ma'am. Kathy Lederhorn, for.
Thank you. Okay, Maisie Jamison.
Maisie Jamison, for.
Thank you. Tamara Rhodes. For. David Saucedo.
For.
Melissa Scott.
For.
Francis Stokes.
For.
Rick Williams.
For.
Kim Wright. And
For.
Kathy Shipp, for. And the motion passes. Thank you. Next, we'll consider agenda item 8.6.6, consideration of proposal for decision, recommendations, proposed settlement agreements, if any, and board action in the matter of permanent certificate 843685 issued to Isoka Edwin Sona, SOA docket number 507-193624. Ms. Abel will present this agenda item. Ms. Abel?
Thank you, Madam President, board members. This case was also a hearing that was held at the State Office of Administrative Hearings. The respondent represented himself, and following that hearing, the administrative law judge found several violations of the Nursing Practice Act and board rules. Specifically from August of 2016 through December of 2017, while the respondent was working as a charge nurse in a dialysis clinic, the respondent incorrectly documented blood flow rates for patients, failed to correct machine settings when he was rounding, challenged patients' beliefs, verbally abused patients, made fun of a patient's leg hurting, and transported a blind patient in his personal vehicle and threatened to leave her at a gas station when he could not locate her home. The administrative law judge found several aggravating factors that contributed to her recommendation. Amongst those was that there were several violations that the respondent committed. Many of those created a significant risk of harm, and the administrative law judge also found that several resulted in actual harm to patients. The administrative law judge also found that all of these patients were physically and emotionally vulnerable by virtue of their illness, and that the respondent, despite being corrected and counseled, made no or little attempt to correct his behavior and demonstrated a lack of insight into his behavior despite the seriousness of the conduct. The administrative law judge also found that there was no evidence of mitigation provided during the hearing. And as a result, the administrative law judge recommended revocation of the respondent's license. That is also what staff is recommending as the sanction. I will point out that the materials provided by the respondent are included in your board packets, as well as the proposed agreed order. And I'm happy to answer any questions that you might have.
Any questions, board members? Okay. Carol Hawkins, could I have a motion, please?
Yes, Madam President, I move to adopt all of the proposed findings of fact and conclusion of law in the PFD and revoke the respondent's license as is set out in the proposed order.
Thank you. And Kim Wright, could I have a second?
Second.
Thank you. Okay. We have a motion and a second, and we'll now take an oral vote. Dr. Edwards?
Alice Edwards, 4.
Diana Rodriguez Flores?
4.
Carol Hawkins?
Carol Hawkins, 4.
Kathy Lederhorn?
Kathy Lederhorn, 4.
Maisie Jamison?
Maisie Jamison, 4.
Tamara Rhodes?
4.
David Saucedo?
4.
Melissa Scott?
4.
Francis Stokes?
4.
Rick Williams?
4.
Kim Wright?
4.
And myself, Kathy Ship, 4. So the motion passes. Next, we'll consider agenda item 8.6.7, consideration of proposal for decision, recommendations, proposed settlement agreements, if any, and board action in the matter of permanent certificate 769760 issued to Brandy Souter, SOA docket number 507-202560. Ms. Abel will present this agenda item. Ms. Abel?
Thank you, Madam President and board members. There was a hearing in this case also at the State Office of Administrative Hearings. The respondent did represent herself, and following that hearing, the administrative law judge found several violations of the Nursing Practice Act and board rules. This time period concerns March 5th of 2018 through April 16th of 2018, in which the respondent incorrectly documented the administration of medications in the patient's medical record. She failed to administer a B12 injection as was ordered by the physician. She failed to change a Foley catheter, as was ordered. She failed to administer several pain medications that were needed and failed to administer 80 medications for various patients. Additionally, the respondent exhibited impaired behavior while on duty to include slow, slurred speech, an unsteady gait, confusion, sluggish movements, and an inability to recognize her fellow coworkers. The administrative law judge also found several aggravating factors in this case. The ALJ found that the respondent's violations were primarily caused by her impaired behavior, which specifically prevented her from being able to practice nursing safely. The respondent failed to present any mitigation and could not explain why the narcotics were not administered. The respondent also admitted that she had been subsequently terminated from 2 separate facilities for impairment on duty following these events at this facility. And the administrative law judge found that taken together, the respondent did not present any evidence that she had addressed the cause of her impairment or that she is currently fit to practice independently, particularly in a home health setting with vulnerable patients. Because of that, the administrative law judge is recommending a reprimand with stipulations to include a medication administration and critical thinking course, direct supervision for 2 years, and abstention and drug testing. Staff is recommending the same stipulations and sanction, a reprimand with stipulations for 2 years to include nursing jurisprudence and ethics, a medication administration course, a critical thinking course, employer notifications, direct supervision, quarterly employer reports, and abstention and drug testing requirements. And I will draw your attention to the fact that the respondent did submit information which is in your board packets, as well as the proposed order. And I'm happy to answer any questions that you might have about this.
Any questions, board members? Okay, Melissa Scott, could you give me a motion, please?
Yes, Madam President. Move to adopt all of the proposed findings of fact and conclusions of law in the PFD and impose a reprimand with stipulations against the respondent's license as is set out in the proposed order.
Thank you. And Maisie Jamison, can you give me a second?
I second her motion.
Thank you. Having a motion and a second, we'll now take an oral vote. Dr. Edwards?
4.
Diana Rodriguez Flores?
4.
Carol Hawkins?
Carol Hawkins, 4.
Kathy Lederhorn?
Kathy Lederhorn, 4.
Maisie Jamison?
Maisie Jamison, 4.
Tamara Rhodes?
4.
David Saucedo?
4.
Melissa Scott?
4.
Francis Stokes?
4.
Rick Williams?
4.
Kim Wright?
4.
And 4, Kathy Ship, myself. And the motion passes. So we're moving to the final agenda item for board discussion is agenda item 9.2, nominations for board vice president for 2021 to 2023. Board members, I'd like to open the discussion for board member nominations for the board vice president for 2021 to 2023 term. So is there anyone that wants to nominate someone or nominate themselves to be a vice president? We've appreciated David, and we will be doing voting, and there's a procedure for the nominees that we'll get to you before October.
Madam President, I would like to make a nomination for Dr. Allison Porter Edwards.
Okay.
Madam President, this is Carol Hawkins. I second that motion.
Okay.
Madam President, this is Diana Flores. Is David Salcedo still eligible to serve as Vice President?
I don't know, Kathy Thomas, we've usually rotated off. I think in my procedure, we haven't. Any individual may be elected to serve as the board's vice president more than once and may serve in consecutive terms, it says. The elected individual will serve. No, let's see, that was a vacancy. It just talks about the process. And do you see anything else, Kathy or Patricia? I just see that statement under process. An individual may be elected to serve as the board's vice president more than once and may serve in consecutive terms. Individuals.
Okay, if he's not opposed, I nominate David Salcedo.
Okay, so we have Allison.
Hey everyone, it's me, David. Diana, thank you. I think it's been a really cool 2 years as your vice president. But I think I'd like to maybe pass the torch. And that's not to say that I won't, consider it again in the future. But I think at this moment, personally, I'd like to pass that responsibility on. So I'd like to, again, Diana, thank you so much. I really am humbled by the support. But just personally, with everything that's going on, I would like to just step back at this moment.
Thank you for that, David. We've appreciated what you've done, and we know that it's been a hard year for you and your family. Okay, so right now we have Dr. Edwards. And is there anyone else or any, Kim? Oh, okay. I thought you raised your hand. Okay. So then I think so we have a nomination by Kathy Lederhorn of Dr. Allison Porter Edwards, and a second of that from Carol Hawkins. So let me look at my. So at this point, that nomination is there, and we can get the process to you, Allison, before the October meeting when we will hold the vote. So we don't vote today. We don't do anything about it. So we have one nomination. So there's no others. Are you shaking your head? You'll take that nomination, Allison? She's giving me a thumbs up. She'll do it. Good.
Yes, thank you so much.
Thank you. And it says you have to be committed to attending regularly scheduled board meetings and functions in order to serve in the role of vice president. And I know you've been engaged all along, so I appreciate that.
I've missed one in 5 years.
Sorry, I had a little coughing. That's good. Cough right at the end. So board members and staff, we've completed all the items on the agenda, and I'm adjourning the January 23, 2020 meeting at this time. And it is 1 1:57. So thank you all for our first virtual quarterly board meeting, and we'll see if we do this again in October or if we'll be face-to-face again. So thank you all. Thank you, staff, Patricia, Dan, all of you have just been amazing on all of this, and for the staff that provides us with all of our information. And it's been a learning curve for all of us, Kathy, Dusty, Gina, Mark, and Tony. I'm looking at everybody that's still on our screen, and Dan. Thank you so much, Dan, for being our IT guy and helping and spending hours with me on my computer the last couple of days. So we appreciate it. Thank you, guys. Everybody stay safe, and thank you for a wonderful meeting.
Thank you.
Thank you.
Thank you.
Bye, everyone.
Bye.
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 Bye.